Senate will come to order. Chaplain Dr. Black will lead the Senate in prayer.
Let us pray. God, from whom all blessings flow, as the mountains punctuate the earth with their beauty, may you shine in our lives to bring loveliness wherever we go. Shape our lawmakers as your vessels to do your good work. Grant them your abundant wisdom and give them the courage to combat evils that plague our world. Lord, revitalize our senators, granting them peace that transcends all understanding. Lead them not into temptation, but deliver them from evil. And Lord, may this season of peace on earth vivify us all. We pray in your astounding name. Amen.
Thank you. Will you please join me in the pledge? I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Now, you ready? Under the previous order, the leadership time is reserved. Under the previous order, the Senate will resume consideration of the motion to proceed to S3386, which the clerk will report.
Calendar number 285, motion to proceed to calendar number 285, S3386, a bill to provide health savings account contribution to certain enrollees and so forth.
A senator from Iowa.
Former Governor Branstad's being honored today. Before I read that tribute about his honoring today, I thought I'd give a little bit of background about what I know about former Governor Branstad. I first met State Representative Terry Branstad January 1973 when he was a new member of the legislature. He would tell you that I actually spoke to a group of Republicans that he was in at the University of Iowa in 1966. I'll take his word for that. He served 6 years in the state legislature. Then we used to elect our lieutenant governor separate from the governor, and he served 4 years as lieutenant governor. Then he was elected governor of Iowa in 1982, served 16 years until 1998. Then he decided to have a private life and a business life. And during those 12 years that he was not governor, we had 12 years of Democratic governors. They left a big fiscal hole. There was a real feeling among Iowans that only former Governor Branstad then could get us back on a strong fiscal path to fiscal sanity in Iowa. So he decided to run for governor again, and he selected now Governor Reynolds as his running mate, and Terry Branstad served until the Trump administration when he was appointed ambassador to China. And The second Branstad administration, continued by Governor Reynolds, has had Iowa on a strong fiscal path, not with any deficits, and reducing taxes, having balanced budgets, and having several billions of dollars in reserve funds. So now I would like to, with that background, talk about the honor that he's getting today. It's an honor for me today to congratulate my good friend Terry Branstad. On this very day, he will become the 26th recipient of what's called the Iowa Award, our home state's highest citizen award. Governor Branstad is the longest-serving governor in U.S. history, who also served Americans as U.S. ambassador to China during his first Trump administration. Like me, Terry grew up on a family farm. Throughout his lifetime of public service, Terry applied the bone-deep work ethic of an Iowa farmer with extra elbow grease, fiscal conservatism, and rock-solid tenacity. He is famous for his retail politicking and his political skill. I'm proud to say that Terry has been a supporter of mine in every one of my congressional campaigns dating back to 1974, and he joins an esteemed group of Iowans, examples like President Herbert Hoover to Norman Borlaug and Grant Wood, who've helped make our state the best home. Barbara and I congratulate Governor Branstad on his well-deserved award and thank him for his friendship and decades of service. I yield the floor.
Majority Whip.
President, I ask unanimous consent to waive the mandatory quorum clause with respect to calendar number 285, S3386, and calendar 284 and S3385.
Without objection.
Mr. President, $83 billion. That's how much Democrats want to send and will vote today to send to bail out a failed Obamacare health care system. Look, I'm a doctor, as are you, Mr. President. We want patients to get the care they need from a doctor they choose at lower costs. Obamacare robbed the American people of choice as well as affordability. So the Democrats are back here today saying they want to send an additional $83 billion directly from the Treasury of the United States to the pockets of the health insurance companies of America. Mr. President, Obamacare has continued to use taxpayer dollars to try to hide the failures. That's what this whole Biden COVID bonus scam is all about. These are juicy subsidies, extra subsidies, on top of the regular Obamacare subsidies, and they're the ones that are expiring at the end of this month. You may recall, Mr. President, that in 2021, the Biden COVID bonuses were rushed through by Democrats, and they called them temporary, emergency measures because of COVID. They created these Biden COVID bonus payments without a single Republican vote. So why'd they create them? It's because Obamacare is unaffordable. People all across the country understand that. Democrats have known it from the beginning. They just refuse to admit it. In 2022, they extended the Biden COVID bonuses, again without a single Republican vote. Now, the tax and spend radicals who run the Democrat Party want to extend them again, these bonuses payments, for an additional 3 years. Oh, and they want to do it with zero reforms. This is a program that is chock full of waste, fraud, abuse, and corruption. And they do nothing to help try to make health care affordable for the families of America. So the choice today is simple. We want to send more taxpayer dollars as welfare to insurance companies, or do we want to make health care more affordable for patients and put patients in control? So let's start with the Democrat bill. The Democrat bill forces Americans to pay $6,000 out of pocket before insurance even kicks in. That's called the deductible. It continues the same failed Obamacare policies that raised premiums for American families by over 220% since Obamacare became law. No reforms. Well, remember, wasn't it President Obama, Mr. President, who said to the nation, oh, if you pass my plan, premiums will go down by $2,500 per year per family? They didn't. They doubled. I think they called that one the lie of the year of Obamacare. Democrats refuse to include any of the needed reforms to deal with the significant flaws and fraud of Obamacare. This month, the government investigators, the GAO, the Government Accountability Office, they uncovered $21 billion being sent in 1 year alone, in 2023, $21 billion sent to insurance companies for policies where there was no verification of that person's income, no verification of their citizenship, no verification, in many cases, of the person's actual existence. Hard to believe, but true. Opinion pieces have been written, even by the Washington Post, that talked about the level of fraud. There are 20 million people on Obamacare right now. You talk about $21 billion for the 20 million divided out. It's about $1,000 worth of potential fraud for each and every enrollee in Obamacare. And what do Democrats want? They want to continue this unchecked for the next 3 years. No changes, no reforms, nothing. Worst of all, Democrats want to send tens of billions of dollars every year directly from the government, directly into the bank accounts of the insurance companies. How have insurance companies felt about this? Hey, they're licking their lips for $83 billion more because insurance companies, their stock prices have gone up between 500 and 1,000% since Obamacare became law. Seems like Democrats are interested in making them even richer. What they're proposing isn't a serious plan. It is a disaster. Our nation can't afford it. The American people can't afford to pay these high costs for health care. We need to focus on the cost of care and how we as doctors can lower that cost of care for American families. So we have a better approach. It's a simple approach. We start with a simple principle. And that principle is health care should work for patients, not for big insurance companies. Our plan sends money that is now going to insurance companies, send it directly into the pocketbooks and into the pockets of the hardworking families of America. That's where the money belongs. It does that by expanding health savings accounts, not direct payments to insurance companies for more Obamacare. Our plan reduces the payments to insurance companies by $30 billion, and it will lower health care premiums by 11%. Our plan puts patients in charge. They'd be in the driver's seat. That's who needs to be in the driver's seat. Real freedom to get the health care that works. Our plan restricts federal Medicaid funding to states that give health insurance to illegal immigrants. People say, oh, you can't be giving it to illegal immigrants. It's illegal to give it to illegal immigrants. Doesn't mean states aren't doing it. And the GAO study found that the Obamacare plans are also and have been used by illegal immigrants. It requires states to verify citizenship prior to signing someone up for Medicaid as well as for Obamacare. And our plan upholds Hyde Amendment protections, protecting Americans' rights of conscience. Our plan is fully paid for. It's an end to the Democrat era of runaway spending to cover up Obamacare's high prices. I'm a doctor, practiced medicine for 24 years in Wyoming, and I can tell you this, Mr. President, When patients have more freedom and more choices, healthcare improves. When patients have more freedom and more choices, costs go down. That's what Republicans are voting for today. And I really want to thank Senator Mike Crapo of Idaho, Senator Bill Cassidy of Louisiana for leading this effort. I want to thank you, Mr. President, for your efforts to find reforms that will actually work, that will help patients, will help lower the cost, put them in charge. That's what we really need to do, lower health care costs for hardworking families. So the contrast is clear. Today, Democrats are going to vote to protect a broken system of higher costs, of rampant fraud, and big checks to insurance companies. Republicans are going to vote for a plan that lowers health care prices and empowers patients. It empowers them to choose the doctor and the care that works best for them. That's what Republicans are committed to. We're committed to delivering what the American people deserve, which is that the care that they need from a doctor they choose at a cost they can afford. Thank you, Mr. President. I yield the floor. Suggest the absence of a quorum.
The clerk will call the roll.
Ms. Also Brooks.
The Democratic leader.
I ask unanimous consent the quorum be dispensed with.
Without objection.
Mr. President, today is D-Day, Decision Day for Republican senators. Will Republicans side today with the American people and avert the impending health care crisis, or will they abandon American families as premiums shoot through the roof on January 1st? That is the decision we must make today. I say to my Republican colleagues, our bill is the last train to leave the station. After wasting precious time fighting among themselves, Republicans have one last shot at a clean, realistic plan to lower health care premiums. The Democratic bill is the only bill that will do that today. Ours is the only bill on either side in the House and Senate that has the full support of every member on our side of the aisle. Democrats are fighting to lower health care costs for the American people, while Republicans are fighting among themselves. By my last count, Republicans are now at 9 different health care proposals and counting, and none of them give the American people the one thing they most want: a clean, simple extension of these health care tax credits. But our bill does extend these credits cleanly and simply for Republicans to join us. So I repeat, our bill is the last train to leave the station. After this, we'll not have time to try again before premiums shoot through the roof next year. This is not a political fight. This is not a symbolic vote. This is a life and death vote, because people who will lose their health care could face that horrible, horrible end. This is about ensuring that working and middle-class people can afford to see a doctor without going broke, to afford a treatment for illnesses like cancer, and enjoy the dignity of good health without wiping out their life savings. Many Americans, affording health insurance is the difference between life and death, as I've said. So we must act. People are counting on us. The American people are counting on us, counting on you, Republican senators, to act. Now, of course, this morning, the Senate will first vote on the Republican health care proposal. But the Republican plan is more than a reflection of the deep divisions inside the Republican caucus and the Republican Party. Republicans have had so many differences amongst themselves that for a while it looked like they weren't going to put up a bill at all. But after that became too embarrassing an option for Republicans, they used Scotch tape and glue to come up with this ridiculous proposal that can't be taken seriously and does nothing to avoid the impending health care crisis. It doesn't extend the ACA tax credits for a day, a month, a year, none of that, not even a day. Even calling this Republican bill a proposal is generous, because the Republican bill is little more than junk insurance. It is no real plan at all. It's been repudiated time and time again in the past, and will be repudiated by the American people again. Under the Republican plan, the big idea is essentially to hand people about $80 a month and wish them good luck. And even to qualify for that check, listen to how bad this is. Americans would be forced onto bare-bone bronze plans with sky-high deductibles, $7,000 or $10,000 for an individual, tens of thousands for a couple. So to get that $80 a month, you're going to pay $7,000 off the top before you even get any health insurance. How ridiculous, how stingy, and how mean and cruel to the American people. What Republicans offer is not a health care plan. The Republican plan is a when you get sick, you go broke plan. And you know, it's sad the Senate even got to this place to begin with. Republicans in the Senate should have solved this problem months. Democrats warned this crisis was coming. We gave Republicans more than 3 chances to extend the tax credits this year, In the spring, the summer, and the fall, and every time, Republicans said no. Instead of lowering premiums, Republicans chose instead to axe health care funding, kick millions off insurance, close rural hospitals, all the while ripping away nutrition funding for working people. Why? So they could give their billionaire buddies a tax break. And now, after so much delay, Republicans are about to let the clock hit midnight. So there's only one option left to avoid falling over this health care cliff that Republicans have brought us to: a clean, simple, direct extension of the current ACA credits. Every single Democrat is unified behind this proposal. I urge Republicans to drop their divisions and join us. Republicans, join us and let's avert a disaster. Join us and let's lower costs for the American people. We have one shot to get this right. Republicans, join us. The American people are watching how Republicans vote today. On the nomination package, today Senate Republicans will move forward with a package of 97 nominees that includes some of the most horribly unqualified, shockingly radical nominees Donald Trump has appointed to date. Historically, when a president nominates such terrible people to positions of power, the Senate has stood as a check on the executive, no matter which president, Democrat or Republican, was in charge. But not this Senate majority, not this Republican Party. Senate Republicans continue to bend the knee to Donald Trump and give him practically any nominee that he wants, no matter how awful they are. They support these nominees, no matter how unqualified they are, no matter how partisan they are, no matter how unethical they are. No questions asked. That's why people like Paul Hollis to be the director of Mint at the Department of Treasury are in the package. If confirmed, Hollis's first act would be to rubber stamp the Trump $1 coin. That's why they picked somebody, because Trump wants a $1 coin with his face on it, I think. And he refused to share details on how he would increase efficiency at the Mint, because he doesn't have a plan. He probably doesn't even know much about it. It's why people like Charles Arrington, to be member of the Federal Relations Board, are on this package. Unlike nearly all former FLRA members, Arrington is not a lawyer. He has a history in engaging in bad faith bargaining while at the VA. The Senate should be considering each of these nominees one by one, with time to debate each nominee on the floor in front of the American people, and with a roll call vote on each nominee so every single senator is on record. And now, Mr. President, I ask unanimous consent that the following senators be permitted to speak for 5 minutes each prior to the cloture vote on the motion to proceed to S3386. Senator Shaheen, Senator Ossoff, Senator Wyden, Senator Durbin, Senator Hassan, Senator Baldwin, and Senator Schumer.
Without objection.
Majority Leader.
Thank you, Mr. President. Mr. President, later today, we will vote on the Democrats' partisan messaging bill, which is a clean 3-year extension of the Biden COVID bonuses. And when I say clean, I mean all that I mean by that is no reforms, straight up extension, 3 years of a program without any reforms, any revisions, any changes that would actually help drive down healthcare costs instead of increasing healthcare costs and get rid of the rampant waste, fraud, and abuse in this program. The Democrats' plan that the Democrat leader called it on the floor the other day, it's their plan. Apparently, they think that a 3-year extension with no reforms to try and disguise the real impact of Obamacare's spiraling costs is actually a plan. I don't know how you can call it a plan. I came down here yesterday, Mr. President, to talk at length about some of the many problems with Obamacare and the perverse incentives it provides to move employees off of employer-provided insurance and into taxpayer-subsidized plans that have rampant year-over-year increases in premiums. The perverse incentives it provides to insurance companies to enroll Americans, some of whom don't even enroll, so that the insurance companies can rake in even more subsidies. And then this so-called plan is rampant, and I say rampant, with fraud and abuse. Mr. President, a Government Accountability Office report released just last week found a whole host of problems, including the successful enrollment of fake individuals, Social Security number fraud, failure to verify or sometimes even request documentation, improper payment of subsidies, and the list goes on. And I want you to just take a look at this. This is the finding that came out of that study that was done by the Government Accountability Office, Mr. President. And here was the conclusion. Obamacare subsidies granted without documentation to 90% of fake accounts set up by a government watchdog. 90%, not 10%, not 5%. I mean, if you had a program that had 10% fraud in it, I think that would be a huge red flag, right? Wouldn't you be alarmed by that? I think most people would. I think most people would go, wow, that's a huge number. We need to do something to fix that. This program that we're talking about today, that they want to do a straight-up extension on, no reforms, no revisions, was found by the Government Accountability Office, an entity and agency that Democrats love and support, found 90% of the accounts that were set up in the Obamacare exchanges were fake. Fake. Think about that. My aching back, Mr. President. This, you can't make this stuff up. We're talking about tens of billions of dollars in waste, fraud, and abuse on a yearly basis. And they don't want to do anything about it. They just want to straight up extend a program that the Government Accountability Office says has a 90% fraud rate. Well, Mr. President, that's obviously a huge problem, but I haven't even gotten to the central problem. And that is that Obamacare has utterly failed to control health care costs. Since 2013, Obamacare enrollees have seen a 221% increase in premiums. Now, let me just repeat that, Mr. President. Since 2013, Obamacare enrollees have seen a 221% increase in premiums. 221%. That means Obamacare premiums have grown at approximately 5 times the rate of inflation. So much for making health care more affordable. Now, Mr. President, this graph, I think, illustrates that, and actually this understates the problem, because this shows since 2014, in the first year of its inception, when the Obama exchanges went live, there was a huge increase that the insurance companies built in their premium cost to cover all the things that they had to cover in the new program. So since 2013, that number is 200. But even since 2014, when the exchanges were fully up and operating, it's a 129% increase in premiums at the same time that the group market, in other words, the large and small group market where a lot of people get their insurance coverage through their employer, was going up at about half that rate, 68% in the small and large group market, which is where about 150 million people get their insurance. And frankly, the more people we could push into that market, it will not only lower their costs, but it also spreads the risk among a bigger pool. And that ultimately is the way in the long term you want to spread your costs. But what Obamacare does, because it uses taxpayer dollars to subsidize and pay insurance companies directly. The premiums go directly to the insurance companies. So insurance companies are making bank. They're getting, but what it does at the same time is there's no incentive to control costs. And it's pushing people into that market. Because if you're an employer, or an employee for that matter, because most people respond to incentives, and you are told that you can get into a market where the taxpayers are going to cover it, and the employer is going to say, well, why should I continue to pay for the health insurance coverage for my employees if I can have the taxpayers pay for it? And so it's pushing more and more people out of the group market, this market right here, where there's a 68% increase, still way too much over the last decade. They're pushing more and more people out of that market into this market, which is double the rate of increase in premiums, and that doesn't include, as I said, the first year in its inception. If you add that first year back in there, that number is 221%. So you've got this system that is pushing more and more people into insurance coverage where the rates are skyrocketing, where the payments are going directly to the insurance companies, and where lower income taxpayers are subsidizing higher income taxpayers because there are no income limits. So now you can have people making $500,000, $600,000 a year are getting subsidized by the federal taxpayer, people making $40,000 or $50,000 a year, at a cost to the federal taxpayer in their bill alone, which is just a 3-year extension, of $83 billion. You tell me in what universe that makes sense. That's astonishing. To have a program where 90% of the people got approved, a program where the rate of increase is twice the rate in the group market and 3 times the rate of inflation, the consumer price index, over the same time period. And the insurance companies are getting rich. Lower income taxpayers are footing the bill, so more affluent Americans can have coverage. And the American taxpayer is paying $83 billion just for the 3-year extension. Waste, fraud, and abuse, higher rates, fiscally irresponsible, and the list goes on. Well, Mr. President, even Democrats have to be well aware of the fact that Obamacare has utterly failed to do what it promised. As I mentioned yesterday, we had one Democrat senator come down to the floor during the shutdown, and to his credit, he admitted the truth, and this is what he said. He said, "We did fail to bring down the cost of health care," to direct quote. We did fail to bring down the cost of health care. So what are Democrats proposing to do about that failure? As I said, exactly nothing. Democrats' so-called plan is a 3-year extension of the status quo. No reforms, no revisions, no rethinking of the way that Obamacare works, just a 3-year extension of the status quo, which I might add was put in place in response to the pandemic. When they extended these subsidies back in 2022, it was in August, the pandemic was long over. Long over. You can't, as I said, you can't make this stuff up. So we're not going to do anything to address the perverse incentives that push Americans out of the employer-sponsored health care system and onto taxpayer-subsidized plans. It's not going to do anything to address the perverse incentives that encourage insurance companies to enrich themselves at taxpayer expense. It's going to do nothing to address the rampant waste, fraud, and abuse in Obamacare. And most of all, Mr. President, it will do nothing to bring down health care costs. Nothing. Zero. Now, under Democrats' plan, insurance premiums will continue to spiral. American taxpayers will find themselves on the hook for ever-increasing subsidy payments. And don't think that all those payments are going to be going to vulnerable Americans. As I said, the Democrats' decision to remove any income cap on the Biden COVID bonuses has Americans making as much as $500,000 or more qualifying for taxpayer subsidies. $500,000. Do Democrats really think middle-class families should be subsidizing health care premiums for those making $500,000? Mr. President, Democrats don't have a health care plan. They don't extend the status quo. A failed, flawed, fraud program that is increasing costs 3 times the rate of inflation. Now, on the other hand, Mr. President, Republicans today will offer something that does actually lower costs. Earlier this week, we introduced legislation drafted by the chairman of the relevant committee, Senators Crapo and Cassidy, to make structural reforms to the individual health insurance market. In contrast to the Democrat bill, our bill would actually lower, as I said, Obamacare premium costs, and it would redirect government savings from the bill into health savings accounts for eligible Obamacare enrollees earning less than 700% of the paired with some affordable insurance plans. These accounts would help individuals to meet their out-of-pocket costs, and for many individuals who don't use their insurance, who barely use it, it would allow them to save for health care expenses down the road. So we have 2 paths here, Mr. President. One, a plan to start addressing the spiraling health care costs in Obamacare and make structural reforms that would drive down premium prices. 2, a proposal for a 3-year extension of the status quo. So you tell me who's serious about actually addressing the affordability of health care. Democrats may talk about helping Americans, but their bill is nothing more than a political messaging exercise that they hope they can use against Republicans next November. And so I hope that after today, they'll feel like they've checked the messaging box and will get serious about actually doing something about the spiraling health care costs under Obamacare. Republicans are ready to get to work, Mr. President. I'm not sure yet the Democrats are interested. Mr. President, I yield the floor.
Senator from New Hampshire.
Mr. President, before I begin my official remarks to address the vote that we're going to be having shortly, I just want to respond to the majority leader's remarks because I think there was some misinformation there. The fact is that 92% of people who get those enhanced premium tax credits are making $200,000 or less. And the average income for a person who receives those premium tax credits is $32,000 a year. That's not somebody in a higher income bracket. And in fact, about 50% of the people who receive premium tax credits are small business owners or their employees who have no other option for health care because they can't afford employer-sponsored health insurance. So I think much of what the majority leader said about costs and about addressing fraud and about lowering the cost of health care is something that we all ought to support. And I'm ready to come to the table, and I think we would be better served if after we get through these votes, we sit down and come to a compromise to address the real costs that people are facing in terms of health care, and I'm ready to do that. But in a few moments, we're going to vote on whether millions of Americans can keep the ACA enhanced premium tax credits or whether they will face a crushing financial blow. These credits have helped millions of families, including tens of thousands of people in New Hampshire, keep their coverage and balance their family budgets. For many, they are the only thing that's standing between stability and a crisis. And I've worked on these tax credits since 2019 when I first introduced the bill. I have warned for more than a year about what would happen to rates if we fail to address this issue in Congress. Well, now that open enrollment has begun, we are seeing the consequences of that failure to act in real time. States and insurers are reporting that significantly fewer people are re-enrolling in health insurance plans because families simply cannot afford the rising premiums. And the Republican proposal that Senators Cassidy and Crapo are introducing doesn't really address that issue. Even those who are re-enrolling are often being pushed into less comprehensive plans that leave them exposed to substantial out-of-pocket costs. Now, yesterday at a forum that I co-hosted with Senator Warner, we heard directly from people who depend on this coverage. Their stories were personal and they were urgent. One small business owner, who's also a healthcare provider, told us that affordable ACA coverage allows her to keep serving new mothers in her community while still caring for her own family. But she also pointed out that if we don't address these premium tax credits, excuse me, that the cost of her health insurance was going to quadruple. Another woman from Concord, New Hampshire, described the moment her son, who lives with a serious mental illness, had his coverage approved. She said she wept with relief. With that coverage, he's been able to work, to live independently, and to get the treatment that he needs. These are real families who have real stakes in this debate that we're having. This is not a game. People are already feeling the impact of inaction. Democrats have put forward a straightforward, immediate solution to prevent the premiums from jumping and to keep people insured. Some of my Republican colleagues have offered ideas I believe could help, and I think that engagement has been constructive. But the time is short. We need to act now. We need to extend the tax credits. I know there are members in both parties who want to find a responsible path forward. I welcome the discussion on where we can find common ground, and I'm ready to come to the table, as I said, with any of my colleagues to work on long-term reforms. But first, we must keep millions of Americans coverage in the coming months. Extending these credits is the easiest and most direct way to protect families. Thank you, Mr. President. I yield the floor.
Senator from Georgia.
Thank you, Mr. President. Mr. President, what is an American supposed to do who loses health insurance in the middle of chemotherapy? That's the question confronting one of my constituents right now. A Georgian who wrote into my office, a woman in her early 60s in the middle of a breast cancer fight. She waits tables for a living. If Republicans allow these Affordable Care Act benefits to expire, her premiums will go up by hundreds of dollars, and she says she'll have to cancel her health coverage. She needs chemo monthly to fight her cancer. What is she supposed to do? Or my constituent with diabetes, who just had major surgery for another health issue just a few months ago, and told me that when she learned that this Congress might let these tax credits expire, she cried. She cried not for herself, she cried because she feared that others would die as a result of this policy choice. And then she got her own insurance quote for next year, hundreds of dollars higher than she's paying now. A diabetic in Georgia who just had major surgery, who says she too will have to cancel her health insurance. And she cried again when she got that insurance quote because suddenly she feared that she might die. She might die. What is she supposed to do? Another constituent who reached out to my office this week, a single mother who relies on medicine that, if she is not insured, would cost her $80,000 per year without insurance. Her premiums about to go up by hundreds of dollars. She too says she probably will have to cancel her insurance. What is she supposed to do? How is she going to afford medicine that costs, without insurance, $80,000 per year? The whole conversation about these Affordable Care Act tax credits in this town and this building has been focused on the politics of this issue. This is life or death. People will die. This is one of the most consequential votes this Senate will take all year. By saying yay or nay to the clerk of the Senate later today, senators will decide whether people live or people die. Senators will decide whether Georgians and folks across the country are financially ruined or have a shot. 500,000 Georgians, it's projected, will lose their coverage altogether. More than 1 million more will see their premiums double or worse. This is a choice. What's the point of having all this power if you won't use it to help people? I remember just a few weeks ago, members of this body wrote into a funding bill $500,000 payments to themselves. Do you remember that? But our own constituents who stand to lose their health insurance in the middle of a cancer fight, what are they supposed to do? My constituents cannot afford this, and some of my constituents cannot survive it. I urge my Republican colleagues to put the politics aside and vote to extend these tax credits for the health of our constituents. Thank you, Mr. President.
Senator from Oregon.
President, there is a runaway train barreling toward our country in the form of a massive increase in health care costs for millions of Americans that are tied to the tracks. Today, the Senate will vote on two different plans. One, offered by Democrats, would save Americans from the health cost freight train and get them off the tracks. The other, offered by Republicans, amounts to tossing Americans a hacksaw and wishing them luck as the train speeds into view. Come January 1st, millions of Americans are going to have to figure out how they're going to pay for health care. Families will be making a near torturous decision between paying their premiums or paying for rent and groceries. Millions will decide to forego coverage completely. The Republican plan on offer is snake oil in a gaping wound. It's going to spark an avalanche of junk insurance plans designed to enrich big insurance companies. A puny savings account to cover the cost of an appendectomy, having a baby, or getting your tonsils out under the Republican plan is going to leave patients up to their eyeballs in financial debt. The biggest winner under this Republican scheme won't be Bartley and Carla of Eugene, Oregon, whose premiums will skyrocket by 500% on January 1. The real winner under the Republican proposal will be big insurance, specifically the biggest, United Health Group. but enriching rich donors and giant corporations while typical Americans foot the bill is pretty much par for the course under a failed Republican leadership. What Democrats offer today is a clean extension of the tax credits to keep ACA plans in place. Every member of this body can agree that healthcare costs and insurance companies are spinning out of control, and more needs to be done to rein them in. But the solution is not kicking millions of people off their health care until Republicans get their act together to find a replacement. I'm now going to take a brief moment to talk about the off-base Republican claims about fraud in the individual market. The fact is, Republicans are cherry-picking statistics or outright distorting the facts to justify kicking millions of people off their health care under the guise of fighting fraud. Independent federal watchdogs recently posed as sleazy insurance brokers to fraudulently enroll Americans in health care plans. That tells me, Mr. President, that what's needed is tough criminal penalties aimed at stopping these unscrupulous insurance brokers. I wrote that legislation that would, for the first time, hit the sleazy insurance brokers with criminal penalties. Based on how much my Republican colleagues talk about fraud, you'd think they'd be tripping over themselves to support our bill, but none of them are doing so. That tells me that their rhetoric is just, I'll close with this. The only timely solution that saves Americans who are now in harm's way is extending these credits and keeping costs down for families. Once the crisis is averted, let's look in a bold new direction for American health care, because it's clear the status quo doesn't work. I urge my colleagues to support a clean extension of the ACA tax credits to provide American families the money they need to pay for high-quality health care. Mr. President, I yield the floor.
Senator from Kansas.
Mr. President, my grandma taught me so many things and had so many great old sayings. One of the things she taught me is that if you have your health, you have everything. If you have your health, you have everything. I think that's one of the reasons I wanted to become a doctor. I wanted to help give people their health. But Mr. President, healthcare is in a crisis right now. Healthcare is in a crisis. Doctors think healthcare is in a crisis. Nurses think healthcare is in a crisis. Patients, families, Americans, we all think that healthcare is in a crisis. And the Democrat solution is frankly just to throw more money at the problem. Throw more money at the problem, which really inflates everybody else's cost of health care. What our party would like to do is to empower patients, not insurance companies. We want to put patients in charge, not insurance companies. And before we dive down a little deeper into our bill that we're asking unanimous consent for today, I want to answer, I think, one of the toughest questions I've been asked. And the question is, when I go back home in January, families are going to look to me and say, why couldn't you fix health care? And I want the record to show right now that the Democrats are walking away from a year-long extension. They're walking away. We're offering it. I don't think the subsidies are a good idea. I never did. But my heart says it's the right thing to do. So let the record show, if the Democrats object to this bill, they're walking away from a year-long extension of Obamacare in exchange for empowering patients. This crisis, I think we need to understand a little bit more where this crisis came from. Obamacare has been the law of the land now for 15 years, and perhaps Speaker Pelosi's most famous moment of her career is when she said, we need to pass the bill so we can see what's in it. Well, now we know what's in it. We know it was written by insurance companies. We're giving them $150 billion a year. It was written by PBMs. It was written by big hospital systems, big healthcare systems who've driven the spend on healthcare for this country now to $5 trillion a year. And what we've ended up with, of course, the costs are higher. No one can deny that the average premiums are now more than 200% higher than they were. Access is worse. Fraud is rampant. And really, Obamacare is junk insurance, right? When they talked about what junk insurance was when they argued for Obamacare, Obamacare is turned into junk insurance. When families have a deductible of $15,000 a year, that's junk insurance, right? So we ended up doing just the opposite of what they stated their intended goals were. So listen to what the Democrats are saying now and then what they're willing to do. Let me just sum up briefly what our plan does, and then I'll maybe go a little bit deeper. Number one is we address the fraud. Number two, we extend the Obamacare, the Biden era extended subsidies for another year. We fund CSRs. We address fraud, if I didn't say that yet. And then starting in 2027, we would start taking some of that money that we were using in subsidies. That's about $35 billion a year. We would start putting that into your debit card, into your healthcare debit card. Thousands of dollars per family. For some it might be $7,000, for some it might be $5,000, but we want you to start making choices. And then lastly, what our bill does, and this is really why I'm so confused why Democrats would walk away from this. If there was one good thing about Obamacare, it was addressing pre-existing conditions, and we'll talk about that more in a second. But our bill funds invisible, high-risk reinsurance pools. So it's like belts and suspenders for people that develop high-risk conditions. So let's dive into each one of these pillars a little bit more. Number one is let's stop the fraud. No one can deny that there's significant fraud in Obamacare. We don't know exactly how much. Is it $20 billion? Is it $30 billion? We know that a third of people in Obamacare never make a claim. A third of people on Obamacare never make a claim. And we know that we saw the fraud increase significantly when we allowed people to have $0 in the game. So what our bill does is, number one, it requires an ID verification, it requires work verification, it requires income verification, and then it requires you to contribute $5 a month. If these were implemented, I really think we would save the country $25 billion a year. And again, that would more than fund this high-risk pool that I'd like to do. I think stopping the fraud, there couldn't be anything more simple. But even just yesterday, the Democrats refused, and they voted down addressing the fraud. Next, our pillar is real price transparency. If we adopted this, the cost of health care for everyone, whether you're on Obamacare or you get your money through your work or you're on Medicare, it would drive down the cost of health care by everybody by 20%. Rather than spending $5 trillion a year, this country would be spending $4 trillion a year. Think of the great things else we could do if we had that money to do better things with it. We could fund community health centers. So many great things we could do out there from a healthcare standpoint as well. But by giving price tags to patients, by forcing every healthcare provider up front to have a list of everything that they offer and have that already on a website ran by CMS, and you're sitting there in your hometown and the doctor says you need to have your knee replaced, and you could automatically have populated within 60 miles all the hospital's charges. And you're going to find some hospitals charge $10,000 for that hip replacement, others charge $60,000 for it, some $120,000 for it. Heck, you might even hop on a plane and fly from New York City to Kansas to save $120,000 on a hip replacement, and we'll put you up in the best hotel in all of Kansas to do that. But price tags is what cures that. Patients into consumers. It lets patients become shoppers again. Boy, over and over again on Black Friday, Americans demonstrate to me that they have strong purchasing power and they know what they're wanting to do with those dollars. So by empowering patients, by turning them into shoppers again, by forcing price tags, this is going to lower the cost of health care for everybody by 20%. Our third pillar is to bridge subsidies for families. Look, you don't have to convince me the cliff people are facing. Because of Obamacare, premiums are going to go up 20 to 30%, regardless of what we do here in Congress. Premiums are going to go up 30%. And I want to help those people. It may be, the people most impacted by this cliff, there's probably 1 million of them. Maybe there's 2 million of them as well. And that's why we need to do more than this bill, is to impact them long term by allowing them to purchase health care across state lines and expand association health care plans. But again, we're extending the subsidies for 1 year. No other deal up here really on the Republican side addresses that except for this particular deal. I know my friends want 3 years. Look, let's talk about it. What would it take for you to actually consider driving the true cost of health care down and not just throwing money at the problem? And I just can't emphasize enough. You're a family of 4, you're making $80,000 a year, which is more than the average salary in Kansas, and you have a $15,000 deductible. That's not access to health care. You have to admit, and I think my Democrats do admit, that Obamacare is broken. Next, I want to just talk about our invisible, state-ran, high-risk pool. Look, I talked a second about pre-existing conditions. The one thing I was really excited about Obamacare was that it took care of the pre-existing conditions. Guess what the most common pre-existing condition is in America? It's pregnancy. Mr. President, I delivered a baby almost every day of my life for 25 years, and believe it or not, less than half of pregnancies are planned. And when couples were purchasing, they get married, they purchase health insurance, and they were going to save a couple $100 by not including pregnancy, they thought it was a good idea. But guess what? Mother Nature doesn't always cooperate. And again, half of these pregnancies were not planned. So I was glad to see us address pre-existing conditions. But even now we know insurance companies do play games to try to keep you out once you have a tough diagnosis. But if those insurance companies knew that, based upon your diagnosis and the money you're spending, you're already going to this partially federally funded high-risk pool, that it would keep everyone's premiums down. And my friends across the aisle talk about, they tug at people's hearts, which I want to do as well. We don't want anyone to face bankruptcy because of healthcare, but that's happening now, right? Admit it, your plan's not working. All these many families are facing and have taken bankruptcy because of the cost of health care. So we use this belt and suspenders approach. We have the pre-existing conditions in Obamacare, we keep those, but then we do something better by funding these high-risk pools as well. High-risk pools let us protect the sick without punishing the healthy. If these catastrophic costs are covered, premiums fall for everyone. That's just simple common sense. If you think about these 5 pillars here that I want the Democrats to agree with, I bet we drive down the cost of health care by 40 to 50%. Our last pillar is just this theme of turning patients into consumers by giving them price tags, by putting federal dollars in your debit account for health care, by giving you price tags. We turn you into shoppers again. It's going to lower the cost for everybody. And then we start reallocating that waste from fraud and abuse. What makes our plan different than anybody else's out there? We address the fraud. We have price tags that no other plan has. It bridges the subsidies. And instead, my Democrats are offering a $83 billion fix. The Democrats are just compounding the junk insurance, with all due respect to my friends across the aisle. Just throwing good money after bad money. By extending these subsidies for 3 years, it'll be at least $83 billion. And the way healthcare is accelerating, it'll be $100 billion. Again, I do feel the pain of these folks. I mean, these are my friends, my neighbors. A top 3 issue for every family in America, for every business in America, is the cost of health care. How can you walk away from a plan that's going to drive the cost of health care down 40 to 50%? And instead, you just want to offer more junk insurance. Your plan doesn't do anything to bring down the cost of the deductibles in the plan. That's the problem. You could pay for their whole premium. We are paying for their whole premium, but then they have a $15,000 deductible. That's not access to health care. I don't know why my friends across the aisle don't want to have meaningful discussions. Why do you not want to talk about fixing the problem? There's so much more than this that we should be talking about right now. Again, pharmacy benefit manager reform comes to mind. Expanding community health centers, making sure everybody has meaningful access to primary care, bringing mental health into those community health centers. Those are all real solutions. Expanding association health care plans, letting it be purchased across state lines. Could you imagine if Sam's Club or Costco or Amazon had an association health plan that you could sign up for? Think of the purchase power that they would have. Mr. President, there's real solutions out there. These are real solutions. Democrats have asked for a plan. This is frankly just the start of a good plan, but it would help bridge us over the next year to go after these other issues we can address on a bipartisan basis. And remember, I'll just close with this, Mr. President. When patients ask their senators in January why their health insurance premiums went up, and they're going to ask you, why did you vote against Senator Marshall's plan that extended the subsidies for a year? I hope you've got a great answer for that. Thank you, Mr. President. I yield back. I ask unanimous consent that the Finance Committee be discharged from further consideration of Senate 3389 and the Senate proceed to its immediate consideration. I further ask that the bill be considered read a third time and passed, and that the motion to reconsider be considered, made, and laid upon the table.
reserving the right to object.
Senator from Delaware.
Mr. President, I had the honor of serving with Senator Marshall in the House. We were classmates. We came in together in 2016. It's kind of ironic to think back to that time because as a freshman, I watched my colleagues try to repeal and replace and repeal and replace and repeal and replace. And just last week, Senator Marshall and I introduced the PBM Disclosure Act together, a bill regarding PBM transparency. We worked on some important things. But at this moment, I can think of nothing more important than addressing our nation's healthcare crisis. Unfortunately, I cannot support what's being proposed here today. Now, we all agree that our healthcare system needs improvement. The Democrats have put forward proposals to do just that. As a matter of fact, Senator Wyden, who is sitting on the floor right here today, has put forward a proposal, a bill that deals with the issue of fraud. And as he said, he'd love his Republican colleagues to join him in that effort. This bill claims to actually attack fraud and also claims to fix the premium crisis. But in reality, it would kick millions of Americans off their ACA health care coverage. Premiums would go up for over 10 million people by an average of $1,000. And to top it all off, this bill adds new abortion restrictions. It is yet another harmful proposal from Republicans while the clock is ticking for the American people. Almost a dozen proposals have been offered by Republicans in the Senate and the House in just the last few weeks. That is tantamount to throwing spaghetti up on a wall to see what sticks. For months, we've asked Republicans to come to the table. During the shutdown, they said they couldn't talk to us about health care. Yet they were still holding hearings on a whole host of things. They spent 6 months before that, in the beginning of the year, passing tax cuts for billionaires. Apparently, that wasn't time to talk to us either. The very first bill I co-sponsored as a United States Senator back in January was the Healthcare Affordability Act, which would have permanently extended the ACA tax credits. Now it is December, almost a year later. As I already said, we've received almost a dozen plans from Republicans, and they're still coming in. As a matter of fact, I think one came in last night. Let us help you help your constituents. Democrats are offering the cleanest, easiest, simplest way to deal with the immediate health care crisis, the immediate health care cliff that Americans are facing, and give us time to improve our health care system. It would even give us a chance to review the thousands of plans and concepts of plans that my colleagues are putting forward. This bill is too little, too late. And for that reason, I respectfully object.
Objecting is heard. Senator from Kansas.
Again, I greatly respect the words and have great respect for my senator, my colleague and good friend from Delaware. And I know both of us share the same heart, that we want every American to have meaningful access to health care. There are many things we agree upon. The PBM Disclosure Act is but one example. Bringing down the cost of prescription drugs would be a huge priority for us as well. We both agree that fraud's a problem. Take this bill and improve it. Is it too little? It probably is too little, but it's a start. It's a framework. You had the legislative text. Look, I've become very pragmatic in my days in Washington. I can't change what happened in 2010 before I got here. I can't change all the histories of dealing with health care. I can't change the fact that we have 100 senators with 100 ideas to fix Obamacare. I've always said tackling Obamacare is like tackling a buffalo that just ran through a barbed wire fence, and every time you try to pull a layer of that barbed wire off, you get poked with it. I understand that. But this is a great framework. It's my effort at a bipartisan framework to get us started. And again, offering the olive leaf of extending the Biden-era subsidies for another year, I think is just the biggest olive branch I can make. And again, come January, my Democrat friends are going to have to answer that question. Why did you walk away from Senator Marshall's plan to extend those subsidies for a year? Thank you, Mr. President. I yield back.
Senator from Louisiana.
Mr. President, what we're debating here are two visions of the future of the Obamacare exchange. Democrats want to cover the cost of health insurance to benefit health insurance companies, and Republicans want to cover the cost of health insurance to benefit patients. Now, I can actually kind of develop that idea. If you look at what Democrats want to do, they want to give 100% of the money to the insurance companies, and the insurance company, by law under Obamacare, can take 20% of it for overhead and profit. 80% of it goes to patient care, but of course, you've got to get your prior authorization and permission for this 80% to be spent upon you. On the other hand, the Republican plan is to put the money into the patient's pocketbook so that she has money to pay for the insurance out of pocket. And here, 100% of the money she receives goes towards some sort of health care or dental care or vision care. By the way, that's a distinction. Under the Democratic plan, the insurance company doesn't cover your dental work. They don't cover the orthodontia for your child. They don't cover the eyeglass. Put it into her pocketbook. Physician, dentist, drugs, vision care. This is a patient-driven account of which 100% is going to the care she knows she needs, and she does not need to seek permission in order to obtain. Now, to put a little bit of a point on it, a 50-year-old couple with children 19 and 20 could get as much as $5,000 in their account. Think of what that means for somebody with chronic disease. If you have diabetes, under the Democratic plan, there's a $6,000 deductible, and someone has to pay $6,000 before they begin to get coverage for everything they need for their chronic disease. Under the Republican plan, putting $5,000 for that couple I spoke of earlier with 2 children, it's in their pocketbook. They can pay for that which they need for chronic disease. So, what's not to like? I would say that the Republican plan meets Americans where they are financially. Most Americans don't have more than $1,000 in their savings account. Let me repeat that. Most Americans don't have $1,000 in their savings account. The Democratic plan would require them to have a deductible to pay $6,000 before the insurance kicks in. So, let's compare the two plans. The red side is the Democratic plan. The green side is the Republican plan. The Democratic plan is to give 100% of the enhanced premium tax credits to insurance companies. The Republican plan is to give the money to the patient, into her pocket, her pocketbook, her purse, to pay the out-of-pocket for the insurance plan. What can it be used for? Under the Democratic plan, it subsidizes premiums. Under the Republican plan, the patient gets the care she knows she needs. The physician visit, the dental visit, the glasses, the prescriptions, and she doesn't need permission to do it. She does it because she knows she needs it. Who makes the decision? Anyone who's fought with insurance companies over prior authorization knows the golden rule applies. The one who has the gold makes the rules. And the insurance company makes the rules as to what you can get. And by the way, that does not cover dental, orthodontic work, eyeglasses, and other things. Here, the patient decides. The patient has the power. It's not profit to insurance companies, it's power to the patient. And if she needs eyeglasses, she uses this money that we put into her account to purchase. If her child needs to go to the dentist for dental cleaning, she can do that. Does it lower cost? Well, if you give the money to the insurance company, clearly it is not. Because since the Obamacare law passed, costs have exploded. But studies show that if you give the patient the money in her pocketbook, she is going to shop for the best deal. She's going to say, wait a second, the x-ray costs $50 here and $500 there, and the difference can be that much. I'm going to go to the place where it's cheaper. Now, as soon as everybody starts going to the place where it's less expensive, the place that is more expensive lowers its cost. That has been shown empirically to work. The Republican plan gives the patient the power to shop, the power to take advantage of price competition, and that lowers cost. One more thing. How does it work with a low-cost bronze plan? Under the Tax Cut for Working Families bill, Republicans passed a law saying that health savings accounts, just kind of putting money in the pocket, can work with a bronze plan. So if you give the money to the bronze plan, permitted under current law, the patient now has the ability to purchase a cheaper plan on the exchange, saving thousands of dollars relative to the plan that Democrats want to force somebody to buy. And what we've seen under the current system is there's all kinds of fraud, there's all kinds of authorized enrollment costing taxpayers billions of dollars. Now, it's been said that somehow Republicans are supporting junk insurance. And you gotta laugh. Mr. President, you gotta laugh. Republicans are using the same plans on Obamacare that Democrats fought for. We are merely taking the framework set up on a unanimous partisan vote by Democrats to create these plans on Obamacare, and that's the one we're using. So for some to call those junk plans, kind of like saying we gave the American people junk. I would argue the Republican Party is making these better. Look at this. Under the Democratic plan, there's a $6,000 deductible. Imagine the housewife who has to take her child into the urgent care center and knows she doesn't have the money. This is a cartoon, but in that cartoon, there's real stress and anxiety for that mama who cannot afford the care she knows her daughter needs. Look at this one, the Republican plan. She's got money in her pocket. She's got money in her account. She's got money in her pocket for the insurance out of pocket. And if she starts off with money in her purse to pay for that need, why can't people see that's where the American people are? If the average American family has less than $1,000 to spend, and our plan puts thousands in their account to pay for the health care they know they need, what is the objection to that? Now, by the way, I think we finally found the objection. There's a concern that Republicans are somehow interjecting abortion politics. And I will point out that Democrats have voted for appropriations bills with high protections since the 70s. For over 4 decades, Democrats have voted for language on this issue, and suddenly, they're shocked. So instead of giving this patient the money she needs, it's going to be sacrificed on the altar of abortion politics. I say go with her. I say support her. Let's go to the last slide, please. We need to make health care affordable again. One, we know that the Democratic extension will not pass. It's going to stick people with $6,000 deductibles. It does nothing for fraud. It is not a solution. What we need is not, by the way, I'm also going to say this. I'm obviously saying we don't need the Democratic solution. My Democratic friends will say they don't like the Republican solution. Let me argue that we try and get an American solution. Not an R, not a D, but an A solution. And if we do so, let's give power to the patient, not profit to the insurance company. Let's make health care affordable again. And with that, I yield.
Minority Whip.
And Senator Bill Cassidy of Louisiana is my friend, my colleague. We work together, and he's a real doctor, a real doctor. And what I've read about your medical career is that you treated people with limited income, and I respect you so much for doing that. Thank you for all that. But I happen to disagree with your policy on this, and let me explain why. How far does $1,000 take you in medical bills? How far does $1,500 take you in medical bills? Well, I had a knee replacement last year. You know what the surgeon's bill was for that? $30,000. $1,000 doesn't take you very far in the 21st century. It didn't take you very far in the 20th century. And to have that as your fallback position to protect yourself, imagine a cancer diagnosis, a shocking cancer diagnosis. And you think, well, thank goodness I've got $1,000 in the bank for treatment for cancer. That isn't going to work. And to say that people are going to have money left over at the end of the day and this is what they really want doesn't reflect reality. I'd be happy to yield.
I didn't show the poster, but in our proposal, taking the 50-year-old couple with 2 kids, 19 and 20, their family would get $5,000 in their account, and the net deductible would be less than the silver plan that Democrats want. So, and the policy, the premium would be $6,000 less a year. So if the plan that my good friend, the minority whip, is saying is the better plan, has a higher net deductible, that I don't think works for the gentleman's knee replacement. And the family $5,000 deductible can $5,000 to stop. And I've taken too much time, but thank you for yielding.
No, I'm happy to yield. And we came perilously close to debate on the Senate floor by my recognition of you. Wouldn't it be something if we did this on a regular basis? Wouldn't it be something if we took this whole issue, the subject matter, and put it into a committee for a real hearing with experts where Democrats and Republicans sat at the same table? It'd be almost like the United States Senate used to be. It doesn't anymore. What I'm suggesting today is simple and direct. I met a waitress at a Chicago Loop restaurant for breakfast last Sunday. She's 63 years old and she spent her life as a waitress. It's taken its toll on her physically. She was in tears as she described to me what's going to happen to her if we fail to act the right way today on this legislation. She's going to see her health insurance bill more than double, $300 or $400 more per month. Let me tell you, she doesn't know how she can do it, and I don't either. That's what we got to address first. Triage, I'd say to my friend Senator Dr. Cassidy, triage is first, help these families pay for their premiums. And then let's do our job. Our job is to sit down and debate his idea, my idea, the ideas of the Senate, and to come up with an alternative that serves the needs of this nation. That's what the Senate is supposed to do. But this take it or leave it high noon strategy isn't fair. If at the end of the day, we fail to help this waitress pay for her premiums and she loses her health insurance, I don't know what's going to happen next. This poor lady is working hard and she has every day of her life. Why we won't come to her rescue first and then get into this policy debate, I just don't understand. Mr. President, as members of the Senate, we cast votes, and many of them are routine, but there are votes that stay with us for decades. I will never forget voting for the Affordable Care Act. It was this time of year, December 24th, 2009, the Senate passed a bill that helped make health care affordable for millions of Americans. It was 8 years later, on a late night in 2017, the late Senator John McCain of Arizona came through those doors at 2 o'clock in the morning, stood in the well right by this table, and lifted his right arm as high as he could and came down with the thumbs no. With that, he saved the Affordable Care Act. That no vote sunk President Trump's first attempt to abolish the Affordable Care Act, and it gave peace of mind to millions of Americans who had come to rely on it. It's been more than 8 years since Senator McCain showed that courage, and 16 years since we passed the original bill. Yet once again, the Senate is about to take another vote on health care that will reverberate for decades throughout America. The question today is whether the Senate will extend the ACA's enhanced premium tax credits. What is that? In the tax code, it's a helping hand to pay your premium based on your family income. If we fail to extend these tax credits, that waitress I've described to you and 22 million Americans will begin to pay double or triple for their insurance in 3 weeks, including 500,000 people living in Illinois. More than 4 million Americans will not be able to afford their insurance at these high rates and be forced to forego health coverage for next year. Merry Christmas. Senate Democrats have sounded the alarm bell about the need to prevent this catastrophe. We've told the stories of people who called our offices crying because they're afraid they won't be able to afford their health care next year. We've shared reports from farmers, small businessmen, rural hospitals who rely on these tax credits. The only thing left to do is vote. The question is whether 13 Republicans will not endorse the Affordable Care Act, but will stand by the people who face these premiums and then be willing to sit down and have a meaningful bipartisan debate on where we should go as a matter of policy. Isn't that what the Senate is all about? Every Senate Democrat is united behind a plan just to extend the ACA enhanced premium tax credit and ensure continued access to quality, affordable health coverage. Republicans are not united behind any plan. They haven't been for 15 years. The Republicans, the devil hates holy water. They can't imagine voting for it. What I ask them to do is hold your nose if you don't like it, vote for it today with the promise that you have the power as the majority party in the Senate to introduce a bill and start a meaningful debate in the appropriate committees. It's your authority. You're in the majority. We need 13 of you today to join us and show the bravery that Senator McCain did in that early morning hour. Otherwise, it will not be those here in the Senate who will remember this vote. Not only those in the Senate, it'll be millions of Americans who saw their senators take their health insurance away. I want to face a friend of long, many, many years who's this waitress in this restaurant and tell her we not only had a chance to help her, we did help her. Let's do that together and then go home and decide what we're going to do as a matter of policy and bring that message back to the Senate for real deliberation. I yield the floor.
Senator from Wisconsin.
I rise today on behalf of the 275,000 Wisconsinites who buy their health insurance through the Affordable Care Act marketplace, and many of whom are downright scared. They're scared because their health care costs are about to double on average. They're scared because they now have to necessity in their life that they can go without. And they are scared because maybe this just puts it beyond reach and they won't be able to afford health care at all. They are scared. And you know what? We actually have the ability to do something about it. At the end of the day, that is what this job is all about. Listening to our constituents, fighting for them. I am not here to instill more anxiety or fear. I am here to help. It's why I first got into public service, and I still believe that to my core. And right now, what Wisconsinites are crying out for is for some breathing room and health care that they can afford. These are real people with very real stories. Take Mark, a retired firefighter from Eagle River. He wrote to me, "As it stands, my monthly health care premiums will increase almost six-fold under this Republican refusal to provide adequate, affordable health care to hardworking Americans, and especially retirees after a lifetime of service." Or take Alicia from Chippewa Falls, who works hard as a child care provider. And like so many workers in the child care industry, Alicia needs these tax credits to afford their insurance and do what they love. Or Callie from Mercer, Wisconsin, a cancer survivor who is facing down a $110 increase to her premiums each month. That might not seem like a lot to my Republican colleagues, but for a local library director in a small rural Wisconsin community, a 30% increase could be the difference between having insurance or not. My Republican colleagues have kicked the can and this crisis further and further down the road. And now, Wisconsin families are looking at changing careers, coming out of retirement, shuttering their small businesses, or selling their family farm. These are real life-changing cost increases that my Republican colleagues seem to be fine with. Because let's be clear, this is, in fact, a choice. It's a fairly simple decision, one that Americans understand. Vote to extend these tax credits or send 22 million Americans off a cliff. The choice is yours, and I yield.
Senator New Hampshire.
Thank you, Mr. President. And I thank the senator, my colleague from Wisconsin, for her remarks. You know, sometimes the wheels of our democracy don't turn as quickly as we'd like. Sometimes progress is painfully slow, but it is a singularly bad day for this body, a bad day for this country, when far from simply failing to move forward, this body chooses to take a great lurch backward, to decide to make the lives of the American people worse. By letting the Affordable Care Act tax cuts expire, by letting health care slip away from families all across our country, today the majority in this body appears to be prepared to do precisely that. Now, just a comment or two about my colleague and friend Senator Cassidy's presentation about the Republican plan just now. Senator Cassidy and I are good friends, and we work on a lot of bipartisan health care legislation today. But let's be clear, the Republican plan that he's talking about doesn't help people afford their premiums in the first place. That's what this is about. And the other issue that my colleague raised about the Hyde Amendment applies to the Affordable Care Act already. What the Republican plan does is now say that people who pay private premium dollars into the ACA cannot use their private dollars to fund what's called elective abortions. So I just want to be clear about those 2 points. And now I want to talk about the progress we've made and the progress we still need to make when it comes to the Affordable Care Act. It's easy to take for granted now as we have grown accustomed to its benefits, but the Affordable Care Act was an important milestone in expanding opportunity for more Americans. The ACA helped millions of Americans who were previously unable to afford insurance to get life-saving care for themselves and their families without breaking the bank or facing bankruptcy. It allowed Americans who have pre-existing conditions to actually buy insurance. It ended lifetime caps on how much treatment people could get. Is the Affordable Care Act perfect? No. It was the product of a legislative compromise. But has the Affordable Care Act made Americans healthier, strengthened our economy, and saved lives? Yes. I want to remind people what our health care system was like before the ACA was passed. People with pre-existing conditions could not get health insurance unless they worked for an employer who offered a group plan, and even then, they had to work enough hours to qualify for that plan. Even people who had insurance were subjected to something called lifetime caps. Often the cap was about $1 million, meaning that if you had a terrible accident or expensive disease, the insurer simply stopped covering your care when the limit was reached, regardless of how long you'd been paying your premiums and regardless of whether you still needed life-saving care. Preventive care could be expensive and was often excluded from health insurance coverage. Now, the ACA changed that. People with pre-existing conditions can now buy insurance. People between jobs can buy insurance. Self-employed people can buy insurance. Life-saving and cost-saving preventive care is covered at no charge, and there are no lifetime limits on care. Now, the smart thing for us to do right now would be for us to build on this progress. There's no shortage of ways in which we need to improve our healthcare system. We need to lower healthcare costs, and there are good bipartisan proposals in this body to do that. And we need to end the inefficient and harmful fragmentation of care. I am ready to work together on a bipartisan basis to do just that. But rather than tackle those problems, the Trump administration has actively worked to make healthcare even less affordable. This summer, the Republicans gutted Medicaid in order to pay for tax breaks for billionaires. Now, with tax credits for the Affordable Care Act due to expire, the President and Washington Republicans will instead allow health insurance premiums to skyrocket for millions of Americans. The American people asked for lower costs. The President is handing them a steeper bill. In recent weeks, too many of the conversations in this chamber about the path forward have gotten stuck in the abstract. We've seen proposals that resemble ideological wish lists rather than the type of compromise that would recognize the reality that Americans are facing on the ground. But I can assure you that for my constituents, rising health care costs are not abstract. It's not abstract for a Granite Stater who will have to pay $1,000 more a month for health insurance. It's not abstract for the family that depended on these tax cuts in order to make ends meet, who don't know if they'll have to pull from their savings or find a cheaper place to rent just to afford these new premiums. And it is not abstract for the untold number of Americans who will miss out on routine care and preventive screenings for cancer and other diseases because they couldn't afford their new premiums. I find myself struck by some of the words that we use in this chamber to talk about health care: risk pool, silver tier, gold tier. Behind all these words and jargon, we're talking about being sick and being healthy, about living with dignity or struggling in despair. We're talking about living and dying. This is an issue that demands the most serious of leadership. But plainly, that's just not what the American people are getting from Donald Trump's Washington today. Today's vote leaves me with a simple question, a question that the majority in this body ought to answer. But by your vote today to make insurance premiums, who in America wins? The majority in this body may carry the day with their votes, but who exactly will this victory be for? What family will be made better off by health insurance becoming more expensive? Which child is going to become healthier? Make no mistake, today's health care vote is more than a vote on a single bill. In a greater sense, in the fight to make American life more affordable, in the effort to save the American people from a looming health care calamity, the majority of this body, the majority in the House, and above all, the President himself, are, in short, choosing to abstain. They are throwing up their hands, essentially saying, nothing we can do here. Given the choice between keeping health care premiums from skyrocketing for millions of Americans or letting these tax cuts expire, the President is content to do nothing. In the face of this health care crisis, in the face of Americans of all political stripes clamoring for a solution, the Republican majority is deciding that the world's greatest deliberative body ought to shrug its shoulders and abdicate its responsibility. So yes, I'll close with this. It's a bad day for this country and for the United States Senate. And it's a day that the American people will remember. Thank you, Mr. President. I yield the floor.
Mr. President.
Senator Idaho.
Mr. President, I ask unanimous consent to speak for up to 5 minutes prior to the scheduled roll call vote.
Without objection.
Thank you, Mr. President. Also, Mr. President, I have 6 requests for committees to meet during today's session of the Senate. They have the approval of the majority and minority leader.
Duly noted.
Thank you, Mr. President.
We've spent a lot of time this week talking about the problems of our healthcare system. Premiums are rising, hospitals are struggling, and out-of-pocket costs are out of control. These problems are not new. And frankly, notwithstanding all of the rhetoric of my colleagues from the other side, the fact is these enhanced premium tax credits that we're debating today, if they were extended or not extended, are not going to change the fact that premiums are skyrocketing. They're skyrocketing because of the failure of our current healthcare system. These problems were used to justify Obamacare in the first place, and Obamacare has progressively made them worse. Americans did not keep their doctors, as was promised under Obamacare. Americans did not keep their insurance plans, and their premiums did not go down. In fact, Obamacare premiums have risen at roughly double the rate of employer-provided health care plans since their inception. Our Democrat colleagues have only had one response to these skyrocketing premiums: more spending, which they claim is going to stop premium increases. In fact, facilitates greater premium increases. Without ever winning a single Republican vote, they created the Obama premium tax credits, expanded them to all Americans, to Americans of all income levels, and then extended that expansion. These credits did not reduce costs and did not reduce premiums. All was shift the cost to taxpayers and help insurance companies to continue to hike premiums higher and higher. Democrats know that Obamacare has failed. They themselves have said so on this floor. But with a deadline quickly approaching again, a deadline that was set by my own Democrat colleagues, they say we have no choice but to extend this failed policy one more time on these premium tax credits. This is a policy they could not even make permanent when they controlled the presidency, the Senate, and the House. Even so, their only offer is more spending. They call their plan a clean extension, a 3-year extension of this program with no reforms, costing hardworking families $83 billion, with tens of billions of dollars going to insurance companies and fraudsters, is anything but clean. Twice on this floor this week, Republicans have offered the Democrats a unanimous consent to have a temporary extension of these premium tax credits with needed reforms to address waste and fraud and abuse that is rampant. And twice this week, that's been rejected. The Government Accountability Office recently uncovered how embarrassingly easy it is to game this Obamacare subsidy system, with the Wall Street Journal calling it a mecca for fraud. Even the Washington Post recognized that Obamacare subsidies get too easy to scam the system. Fortunately, we have another option. Instead of the Minority Leader's $83 billion extension, which would do absolutely nothing to reduce fraud and would keep driving premiums higher, Senator Cassidy and I have offered a fiscally responsible proposal that will reduce premiums, save taxpayers money, and give Americans control over their health care. Our bill provides pre-funded, patient-driven health savings accounts for Americans enrolled in qualified Obamacare bronze and catastrophic plans. Important low-income Americans will still receive subsidies for those Obamacare plans through the permanent portion of the premium tax credit system. Americans who choose this option will have both insurance coverage and help paying for their remaining out-of-pocket costs, all without giving insurance companies a reason to enroll them in plans without their knowledge, as has occurred for years. Our bill also fixes an error in the original design of Obamacare by funding the cost-sharing reductions that it mandated, reducing benchmark premiums by 11%. Let me point that out. That piece of our proposal will reduce premiums by 11%. The minority leader's plan is not going to pass. But if just a few of my Democrat colleagues will join us in voting for our bill, we can put this crisis behind us and lay the groundwork for true reforms. For instance, Senator Wyden and I remain intent on getting our bipartisan pharmacy benefit manager reform to the president's desk. We have many other bipartisan agreements on needed health care reforms that we need to move forward on. The choice before us is clear. We can continue with business as usual and extend the same policy that has brought our health care system to the point where every member of this body admits that it's broken. Or we can try something different. We can change the incentives that Obamacare gives insurers to drive premiums higher and put our confidence in Americans to make the best decisions about their own health care. If we fall off the Democrat-created subsidy cliff, it will not be because we did not have a different choice. Thank you, Mr. President. I yield the floor.
President.
Minority Leader.
Mr. President, today is D-Day, decision day for Republican senators. Will Republicans side with the American people and avert the disastrous impending health care crisis? Or will they abandon American families as premiums shoot through the roof come January 1st? In a few moments, the Senate will vote on two bills, the Republican bill and Democrats' clean, simple extension of the ACA tax credits. I say to my Republican colleagues, our bill is the last train to leave the station. It is the only realistic option before the Senate today that solves the health care crisis. If Republicans don't climb aboard, there won't be another chance to act before premiums skyrocket next year. Now, Republicans have dithered long enough. Democrats are fighting to lower costs for the American people, while Republicans are fighting among themselves. And let me say this about the Republican bill. The Republican bill is not true health care reform. It is not a health care plan whatsoever. It is junk insurance. The Republican bill is simply junk insurance. For a while, it actually looked like the Republicans wouldn't put up a bill at all. But after that became too embarrassing an option for them, they used Scotch tape and glue to come up with this ridiculous proposal that can't be taken seriously. The Republican plan does nothing to extend the tax credits for even a day. Our bill, of course, extends them for 3 years. Under the Republican plan, the big idea is essentially to hand people about $80 a month and wish them good luck, say you're on your own no matter what happens. And to even qualify for that check, Americans would be forced onto bare-bone bronze plans with sky-high deductibles, $7,000 or $10,000 for an individual and tens of thousands for a couple. So the deductibles are so high that even that is not paid for by the $80 a month. And then Americans are stuck and have nothing. The Republican plan is a when you get sick, you go broke plan. Plain and simple. The only answer, the only right answer to solve this crisis is what Democrats propose today, a clean, simple extension of current tax credits. Our bill is the only plan that halts premiums from shooting through the roof. And as Americans know, this is not a symbolic vote. This is a life and death vote for millions of people wondering if they'll be able to afford health insurance next year. Millions will lose health insurance. Tens of millions will have to change plans and doctors and get high deductibles and high co-payments that they can hardly afford health care if we don't do this. So America is counting on us, the Senate. Republicans, America is counting on you to do the right thing and vote yes on our bill. A yes vote on our bill means premiums will not double or triple or more starting January 1st. A yes vote means lower costs for the American people and greater help for them to pay for the things they need. A yes vote means dignity, security, and peace of mind for tens of millions of American families. It means our healthcare system averts a disaster. There is only one right thing to do, and that's for Republicans to vote yes on our bill. The American people will not forget which way senators vote today. I yield the floor.
The clerk will report the motion to invoke cloture.
Cloture motion. We, the undersigned senators, in accordance with the provisions of Rule 22 of the Standing Rules of the Senate, do hereby move to bring to a close debate on the motion to proceed to calendar number 285 S3386, a bill to provide health savings account contribution to certain enrollees to reduce health care costs and for other purposes, signed by 17 senators.
Under the previous order, the mandatory quorum call under Rule 22 has been waived. The question is it the sense of the Senate that debate on the motion to proceed to S3386, a bill to provide a health savings account contribution to certain enrollees to reduce health care costs and for other purposes shall be brought to a close? The yeas and nays are mandatory under the rule. The clerk will call the roll.
Ms. Also Brooks, Ms. Baldwin, Mr. Banks, Mr. Barrasso, Mr. Bennett, Mrs. Blackburn, Mr. Blumenthal, Ms. Rochester, Mr. Booker, Mr. Bozeman, Mrs. Britt, Mr. Budd, Ms. Cantwell, Mrs. Capito, Mr. Cassidy, Ms. Collins, Mr. Coons, Mr. Cornyn, Ms. Cortez Masto, Mr. Cotton, Mr. Kramer, Mr. Crapo, Mr. Cruz, Mr. Curtis, Mr. Daines, Ms. Duckworth, Mr. Durbin, Ms. Ernst, Mr. Fetterman, Mrs. Fisher, Mr. Gallego, Mrs. Gillibrand, Mr. Graham, Mr. Grassley, Mr. Haggerty, Ms. Hassan, Mr. Hawley, Mr. Heinrich, Mr. Hickenlooper, Ms. Hirono, Mr. Hoven, Mr. Husted, Mrs. Hyde-Smith, Mr. Johnson, Mr. Justice, Mr. Kane, Mr. Kelly, Mr. Kennedy, Mr. Kim, Mr. King, Ms. Klobuchar, Mr. Langford, Mr. Lee, Mr. Lujan, Ms. Lummis, Mr. Markey, Mr. Marshall, Mr. McConnell, Mr. McCormick, Mr. Merkley, Mrs. Moody, Mr. Moran, Mr. Moreno, Mr. Mullen, Ms. Murkowski, Mr. Murphy, Mrs. Murray, Mr. Ostov, Mr. Padilla, Mr. Paul, Mr. Peters, Mr. Reed, Mr. Ricketts, Mr. Risch, Ms. Rosen, Mr. Rounds, Mr. Sanders, Mr. Schatz, Mr. Schiff, Mr. Schmidt, Mr. Schumer, Mr. Scott of Florida, Mr. Scott of South Carolina, Mrs. Shaheen, Mr. Sheehy, Ms. Slotkin, Ms. Smith, Mr. Sullivan, Mr. Thune, Mr. Tillis, Mr. Tuberville, Mr. Van Hollen, Mr. Warner, Mr. Warnock, Ms. Warren, Mr. Welch, Mr. Whitehouse, Mr. Wicker, Mr. Wyden, Mr. Young. Senators voting in the affirmative: Barrasso, Cassidy, Cornyn, Cotton, Crapo, Kennedy, Marshall, Ricketts, Scott of Florida, Sheehy, Baldwin. Senators voting in the negative: Baldwin, Fetterman, Kelly, Kim, Klobuchar, Lujan, Murray, Ossoff, Shaheen. Mrs. Capito, aye. Mr. Kramer, aye. Ms. Slotkin, no. Mr. Durbin, no. Mr. Peters, no. Ms. Cantwell, no. Mrs. Moody, aye. Ms. Hassan, no. Mr. Wyden, no. Mr. Curtis, aye. Mr. Kane, no. Mr. Husted, aye. Mr. Coons, no. Mr. Gallego, Mr. Gallego, no. Mr. Welch, no. Mr. Warnock, no.
What are you doing this weekend?
Mr. Johnson, aye.
I have to get my Christmas.
Mr. Reed, no. Mr. Haggerty, aye. Mr. Schumer, no. Ms. Duckworth, no. Mr. Schatz, no. Mr. Blumenthal, no. Mr. Young, aye. Mr. Wicker, aye. Mr. Rounds, aye. Mr. Budd, aye. Mr. Schiff, no. Mr. Hawley, aye. Mr. Mullen, aye. Mr. Van Hollen, no. Mr. Langford, aye. Ms. Lummis, aye. Ms. Smith, no. Mr. Heinrich, no. Mrs. Gillibrand, no. Mr. Murphy, no. Mr. Markey, no. Ms. Collins, aye. Mr. Grassley, aye. Mr. Merkley, no. Mr. McCormick, aye. Yes. Miss Rosen, no. Mr. King, no. Mr. Banks, aye. Mrs. Blackburn, aye. Ms. Cortez Masto, Ms. Cortez Masto, no. Mr. Lee, Mr. Lee, aye. Mr. Warner, no. Mr. Scott of South Carolina, aye. Mr. Padilla, no. Mrs. Hyde Smith, aye. Mr. Moran, aye. Mr. Thune, aye. Mr. Paul, no. Ms. Markowski, aye. Mr. Risch, aye. Mr. Sanders, no. Ms. Ernst, aye. Mr. Justice, aye. Mr. Cruz, aye. Mr. Sullivan, aye. Mrs. Britt, aye. Mr. Bozeman, aye. Ms. Blunt Rochester, no. Mr. Bennett, no. Ms. Warren, no. Mr. Hoven, aye. Mr. Moreno, aye. Mr. Hickenlooper, no. Mr. McConnell, aye. Ms. Brooks, no. Mr. Graham, aye. Mr. Tuberville, aye. Ms. Hirono, no. Mr. Schmidt, aye. Mrs. Fisher, aye. Mr. Booker, no. Mr. Tillis. Aye. Mr. Whitehouse, no.
On this vote, the yeas are 51, the nays are 48. 3/5 of the Senate's daily chosen. 3/5 of the senators duly chosen and sworn. Not having voted in the affirmative, the motion is not agreed to. You guys got to get bigger type for us. All right, start here. The clerk will report the motion to invoke cloture.
Cloture motion. We, the undersigned senators, in accordance with the provisions of Rule 22 of the Standing Rules of the Senate, do hereby move to bring to a close the debate on the motion to proceed to calendar number 284 S3385, a bill to amend the Internal Revenue Code of 1986 to extend the enhancement of the health care premium tax credit, signed by 17 senators.
Under the previous order, the mandatory quorum call under Rule 22 has been waived. The question is it the sense of the Senate that debate on the motion to proceed to S 3385, a bill to amend the Internal Revenue Code of 1986 to extend the enhancement of the health care premium tax credit shall be brought to a close? The yeas and nays are mandatory under the rule. The clerk will call the roll.
Ms. Also Brooks. Thank you. Mrs. Baldwin, Ms. Baldwin, Mr. Banks, Mr. Barrasso, Mr. Bennett, Mrs. Blackburn, Mr. Blumenthal, Ms. Blunt Rochester, Mr. Booker, Mr. Bozeman, Mrs. Britt, Mr. Budd, Ms. Cantwell, Mrs. Capito, Mr. Cassidy, Ms. Collins, Mr. Coons, Mr. Cornyn, Mr. Cornyn, Ms. Cortez Masto, Mr. Cotton, Mr. Kramer, Mr. Crapo, Mr. Cruz, Mr. Curtis, Mr. Daines, Ms. Duckworth, Mr. Durbin, Ms. Ernst, Mr. Fetterman, Mrs. Fisher, Mr. Gallego, Mrs. Gillibrand, Mr. Graham, Mr. Grassley, Mr. Haggerty. Thank Mr. Grassley, Mr. Haggerty. Ms. Hassan, Mr. Hawley. Mr. Hawley, Mr. Heinrich, Mr. Hickenlooper, Ms. Hirono, Mr. Hoven, Mr. Husted, Mrs. Hyde-Smith, Mr. Johnson, Mr. Justice, Mr. Kane, Mr. Kelly, Mr. Kennedy, Mr. Kim, Mr. King, Ms. Klobuchar, Mr. Langford, Mr. Lee, Mr. Lujan, Ms. Lummis, Mr. Markey, Mr. Marshall, Mr. McConnell, Mr. McCormick, Mr. Merkley, Mrs. Moody, Mr. Moran, Mr. Marino, Mr. Mullen, Ms. Murkowski, Mr. Murphy, Mrs. Murray, Mr. Ossoff, Mr. Padilla, Mr. Paul, Mr. Peters, Mr. Reed, Mr. Ricketts, Mr. Risch, Ms. Rosen, Mr. Rounds, Mr. Sanders, Mr. Schatz, Mr. Schiff, Mr. Schmidt, Mr. Schmidt, Mr. Schumer, Mr. Scott of Florida, Mr. Scott of South Carolina, Mrs. Shaheen, Mr. Sheehy, Ms. Slotkin, Ms. Smith, Mr. Sullivan, Mr. Thune, Mr. Tillis, Mr. Tuberville, Mr. Van Hollen, Mr. Warner, Mr. Warnock, Ms. Warren, Mr. Welch, Mr. Whitehouse, Mr. Wicker, Mr. Wyden, Mr. Young. Senators voting in the affirmative: Also Brooks, Blumenthal, Blunt Rochester, Booker, Collins, Cortez Masto, Durbin, Fetterman, Gallego, Hickenlooper, Hirono, Kane, King, Merkley, Murkowski, Murphy, Murray, Reed, Rosen, Sanders, Schumer, Shaheen, Smith, Warren, Whitehouse, and Wyden. Senators voting in the negative: Banks, Barrasso, Blackburn, Bozeman, Britt, Budd, Cassidy, Ernst, Fisher, Grassley, Haggerty, Hoven, Husted, Justice, Lummis, Marshall, McConnell, McCormick, Moran, Mullen, Paul, Schmidt, Thune, Tillis, Tuberville, and Wicker. Mr. Schatz, aye. Mr. Kramer, no. Mr. Crapo, no. Mr. Bennett, aye. Mr. Coons, aye. Mrs. Hyde-Smith, no. Mr. Markey, aye. Mr. Lee, no. Mr. Cotton, no. Mr. Sullivan, aye. Mr. Cornyn, no. Mr. Kelly, aye. Mr. Sheehy, no. Ms. Hassan, aye. Mr. Kennedy, no. Mr. Schiff, aye. Mrs. Gillibrand, aye. Mr. Lujan, aye. Mr. Langford, no. Mr. Scott of Florida, no. Mr. Padilla, aye. Mr. Kim, aye. Mr. Ricketts, no. Mr. Graham, no. Ms. Cantwell, aye. Mr. Peters, aye. Mrs. Capito, no. Mr. Johnson, no. Mr. Warnock, aye. Mr. Scott of South Carolina, no. Mr. Curtis, no. Mr. Ossoff, aye. Ms. Slotkin, aye. Mr. Cruz, no. Mr. Welch, aye. Mr. Marino, no. Mr. Van Hollen, aye. Mr. Heinrich, aye. Ms. Baldwin, aye. Mr. Rounds. Mr. Rounds, no. Mr. Young. Mr. Young, no. Ms. Duckworth. Ms. Duckworth, aye. Mr. Hawley. Mr. Hawley, aye. Mrs. Moody. Mrs. Moody, no. Ms. Klobuchar. Ms. Klobuchar, aye. Mr. Warner. Mr. Warner, aye. Mr. Risch, no.
Damn it, just tell me. I can't. Recess of the Senate. Let's see. On this vote, the ayes are 51, the nays are 48. 3/5 of the senators duly chosen and sworn not having voted in the affirmative. The motion is not agreed to. Under the previous order, the Senate will proceed to executive session and resume consideration of Senate Res 532, which the clerk will report.
Executive calendar number 4, S-Res 532, an executive resolution authorizing the en bloc consideration in executive session of certain nominations on the executive calendar.
All post-cloture time has expired. The question is on adoption of the resolution. Ask the ayes and nays. Is there a sufficient second? There appears to be. Yeah. Clerk will call the roll, please.
Ms. Alsobrooks, Ms. Baldwin, Mr. Banks, Mr. Barrasso, Mr. Bennett, Mrs. Blackburn, Mr. Blumenthal, Ms. Blunt-Rochester, Mr. Booker, Mr. Bozeman, Mrs. Britt, Mr. Bubb, Ms. Cantwell, Mrs. Capito, Mr. Cassidy, Ms. Collins, Mr. Coons, Mr. Cornyn, Ms. Cortez Masto, Mr. Cotton, Mr. Kramer, Mr. Crapo, Mr. Cruz, Mr. Curtis, Mr. Daines, Ms. Duckworth. There we go. Thank you. Mr. Durbin. Gotcha. Yes, I do. Thank you. Gotcha. Thank you. Mr. Fetterman. Mrs. Fisher. Mr. Gallego. Mrs. Gillibrand. Thanks. Mr. Graham. Mr. Graham. Mr. Grassley. Mr. Haggerty. Thank you. Ms. Hassan. Mr. Hawley. Mr. Heinrich. Mr. Hickenlooper. Ms. Hirono. Mr. Hoven. Mr. Husted. Mrs. Hyde-Smith. Mr. Johnson. Mr. Justice. Mr. Kane. Mr. Kelly. Mr. Kennedy. Mr. Kim. Mr. King. Ms. Klobuchar. Mr. Langford. Mr. Lee. Mr. Lujan. Ms. Lummis. Mr. Markey. Mr. Marshall. Mr. McConnell. Mr. McCormick. Mr. Merkley. Mrs. Moody. Mr. Moran. Mr. Marino. Mr. Mullen. Ms. Murkowski. Mr. Murphy. Mrs. Murray. Mr. Ossoff. Mr. Padilla. Mr. Paul. Mr. Peters. Mr. Reed. Mr. Ricketts. Mr. Risch. Ms. Rosen, Mr. Rounds, Mr. Sanders, Mr. Schatz, Mr. Schiff, Mr. Schmidt, Mr. Schumer, Mr. Scott of Florida, Mr. Scott of South Carolina, Mrs. Shaheen, Mr. Sheehy, Ms. Slotkin, Ms. Smith, Mr. Sullivan, Mr. Thune, Mr. Tillis, Mr. Tuberville, Mr. Van Hollen, Mr. Warner, Mr. Warnock, Ms. Warren, Mr. Welch, Mr. Whitehouse, Mr. Wicker, Mr. Wyden, Mr. Young. Senators voting in the affirmative: Budd, Capito, Cotton, Cruz, Ernst, Grassley, Hyde-Smith, Johnson, Kennedy, Moody, Mullen, Paul, Risch, and Rounds. Senators voting in the negative: Baldwin, Cantwell, Duckworth, Durbin, Fetterman, Heinrich, Hirono, Kelly, Kim, Lujan, Murphy, Padilla, Peters, Rosen, Schiff, Smith, Warner, Warren, Whitehouse, and Wyden. Ms. Lummis, aye. Mr. Barrasso, aye. Mr. McConnell, aye. Mr. Schatz, no. Mr. Ricketts, aye. Mr. Husted, aye. Mr. Moran, aye. Mr. Wicker, aye. Mr. Marshall, Aye. Mrs. Gillibrand, no. Ms. Alsobrooks, no. Mr. Blumenthal, no. Mr. Banks, aye. Mr. Markey, no. Mrs. Blackburn, aye. Ms. Collins, aye. Mr. Haggerty, aye. Mr. Scott of Florida, aye. Mr. Lee, aye. Mr. Gallego, no. Mr. Cornyn, aye. Mr. Marino, aye. Mr. Crapo, aye. Mrs. Britt, aye. Mr. Langford, aye. Mr. McCormick, aye. Ms. Hassan, no. Mr. Young, aye. Mr. Tillis, aye. Ms. Cortez Masto, no. Mr. Hoven, aye. Mr. Hawley, aye. Mr. Welch, no. Mr. Reed, no. Mrs. Fisher, aye. I don't care. Mr. Scott of South Carolina, aye. Ms. Slotkin, no. Mrs. Shaheen, no. Mr. Thune, aye. Mr. Ossoff, no. Mr. Graham, aye. Mr. Kramer, aye. Mr. Bozeman, aye. Mr. King, no. Mr. Schmidt, aye. Mrs. Murray, no. Ms. Rochester, no. Mr. Merkley, no. Mr. Van Hollen, no. Ms. Murkowski, aye. Mr. Warnock, no. Mr. Tuberville, aye. Mr. Sanders, no. Mr. Booker, no. Mr. Coons, no. Mr. Curtis, aye. Ms. Klobuchar, no. Mr. Sheehy, aye. Mr. Schumer, no. Mr. Kane, no. Mr. Bennett, no. Mr. Justice, aye. Oh, no. Oh, my God. You did. You did. Mr. Hickenlooper, no. Mr. Sullivan, aye. Mr. Cassidy, aye.
On this vote, the yeas are 52, the nays are 47, and the resolution is agreed to. Under the previous order, the motion to reconsider is considered made and laid upon the table. Under the previous order, the Senate will resume legislative session and be in a period of morning business, with senators permitted to speak therein for up to 10 minutes each.
Mr. President.
Senate Majority Leader is
Mr. President, I
recognized.
understand the Senate's received a message from the House to accompany S. 1071.
The Leader is correct.
Mr. President, I ask that the Chair lay before the Senate the House message to accompany S. 1071, and I ask for the ayes and nays.
Is there a sufficient second? There appears to be. Clerk will call the roll.
Ms. Alsobrooks, Ms. Baldwin, Mr. Banks, Mr. Barrasso, Mr. Bennett, Mrs. Blackburn. Mrs. Blackburn, Mr. Blumenthal, Ms. Blunt Rochester, Mr. Booker, Mr. Bozeman, Mrs. Britt, Mr. Budd, Ms. Cantwell, Mrs. Capito, Mr. Cassidy, Ms. Collins, Mr. Coons, Mr. Cornyn, Ms. Cortez Masto, Mr. Cotton, Mr. Kramer, Mr. Crapo, Mr. Cruz, Mr. Curtis, Mr. Daines, Ms. Duckworth, Mr. Durbin, Ms. Ernst, Mr. Fetterman, Mrs. Fisher, Mr. Gallego, Mrs. Gillibrand, Mr. Graham, Mr. Grassley, Mr. Haggerty, Ms. Hassan, Mr. Hawley, Mr. Heinrich. Mr. Heinrich, Mr. Hickenlooper, Ms. Hirono, Mr. Hoven, Mr. Husted, Mrs. Hyde-Smith, Mr. Johnson, Mr. Justice, Mr. Kane, Mr. Kelly, Mr. Kennedy, Mr. Kim, Mr. King, Ms. Klobuchar, Mr. Langford, Mr. Lee, Mr. Lujan, Ms. Lummis, Mr. Markey, Mr. Marshall, Mr. McConnell, Mr. McCormick, Mr. Merkley, Mrs. Moody, Mr. Moran, Mr. Marino, Mr. Mullen, Ms. Murkowski, Mr. Murphy, Ms. Murkowski, Mr. Murphy, Mrs. Murray, Mr. Ossoff, Mr. Padilla, Mr. Paul, Mr. Peters, Mr. Reed, Mr. Ricketts, Mr. Risch, Ms. Rosen, Mr. Rounds, Mr. Sanders, Mr. Schatz, Mr. Schiff, Mr. Schmidt, Mr. Schumer, Mr. Scott of Florida, Mr. Scott of South Carolina, Mrs. Shaheen, Mr. Sheehy, Ms. Slotkin, Ms. Smith, Mr. Sullivan. Mr. Thune, Mr. Tillis, Mr. Tuberville, Mr. Van Hollen, Mr. Warner, Mr. Warnock, Ms. Warren, Mr. Welch, Mr. Whitehouse, Mr. Wicker, Mr. Wyden, Mr. Young. Senators voting in the affirmative: Banks, Barrasso, Blackburn, Blumenthal, Bozeman, Cornyn, Kramer, Crapo, Curtis, Fetterman, Fisher, Gallego, Grassley, Hassan, Hyde-Smith, Justice, Kane, Kelly, Kennedy, King, Langford, Lee, Lujan, Lummis, Marshall, McCormick, Marino, Mullen, Murkowski, Ossoff, Peters, Reed, Ricketts, Risch, Rounds, Schmidt, Scott of Florida, Scott of South Carolina, Shaheen, Slotkin, Sullivan, Thune, Tillis, Tuberville, Warner, Whitehouse, and Young. Mr. Heinrich, aye. Mr. Durbin, aye. Senators voting in the negative: Bennett, Kim, Murphy, Murray, Padilla, Paul, Sanders, Schatz, and Wyden. Mr. Johnson, aye. Mr. Lee, no. Mrs. Capito, aye. Mr. Wicker. Mr. Wicker, aye. Mr. Van Hollen. Mr. Van Hollen, no. Mr. Coons. Mr. Coons, aye. Ms. Ernst. Ms. Ernst, aye. Ms. Rosen. Ms. Rosen, aye. Mr. Budd. Mr. Budd, aye. Ms. Collins. Ms. Collins, aye. Mr. Cotton. Mr. Cotton, aye. Mr. Husted. Mr. Husted, aye. Ms. Klobuchar. Ms. Klobuchar, aye. Mr. Hoven. Mr. Hoven, aye. Mr. Haggerty. Mr. Haggerty, aye. Ms. Alsterbrooks. Ms. Alsterbrooks, no. Ms. Cortez Masto. Ms. Cortez Masto, aye. Ms. Duckworth. Ms. Duckworth, no. Ms. Cantwell. Ms. Cantwell, aye. Ms. Cantwell. Ms. Cantwell, no. Ms. Baldwin. Ms. Baldwin, aye. Mrs. Gillibrand. Mrs. Gillibrand, aye. Ms. Alsterbrooks. Ms. Alsterbrooks, aye. Mr. Ono. Mr. Ono, aye. Mr. Cassidy. Mr. Cassidy, aye. Mrs. Britt. Mrs. Britt, aye. Mr. Moran. Mr. Moran, no. Ms. Smith. Ms. Smith, no. Ms. Blunt Rochester. Ms. Blunt Rochester, aye. Mr. Graham. Mr. Graham, aye. Mr. Cruz. Mr. Cruz, aye. Mr. Markey. Mr. Markey, no. Mr. Welch. Mr. Welch, no. Mr. Schumer. Mr. Schumer, aye. Mr. McConnell. Mr. McConnell, aye. Mr. Cruz. Mr. Cruz, no. Mr. Warnock. Mr. Warnock, aye. Mr. Sheehy. Mr. Sheehy, aye. Mr. Merkley. Mr. Merkley, no. Mr. Schiff. Mr. Schiff, no. Ms. Warren. Ms. Warren, no. Mr. Booker. Mr. Booker, no. Mr. Hickenlooper. Mr. Hickenlooper, aye.
On this vote, the yeas are 75, the nays are 22. The motion is agreed to. The chair lays before the Senate the following message from the House.
Resolved that the bill from the Senate S. 1071, entitled An Act to Require the Secretary of Veterans Affairs to disinter the remains of Fernando V. Cota from Fort Sam Houston National Cemetery, Texas, and for other purposes, do pass with an amendment.
I recognize the Majority Leader.
Thank you, Mr. President. Mr. President, I move to concur in the House amendment to S. 1071.
The clerk will report.
Senator from South Dakota, Mr. Thune, moves to concur in the House amendment to S. 1071.
Mr. President, I send a cloture motion to the desk for the motion to concur.
The clerk will report.
Cloture motion, we the undersigned senators, in accordance with the provisions of Rule 22 of the Standing Rules of the Senate, do hereby move to bring to a close debate on the motion to concur in the House amendment to S. 1071, a bill to require the Secretary of Veterans Affairs to disinter the remains of Fernando V. Cota from Fort Sam Houston National Cemetery, Texas, and for other purposes, signed by 17 senators as follows.
Mr. President, I ask that the reading be dispensed with.
Without objection.
And I move to concur in the House amendment with an amendment.
The clerk will report.
Senator from South Dakota, Mr. Thune, moves to concur in the House amendment to S. 1071 with an amendment numbered 3961.
Mr. President, I ask that the reading be dispensed with.
Without objection.
And I ask for the yeas and nays on the motion.
Is there a sufficient second?
Yes.
It appears to be. The yeas and nays are ordered.
Mr. President, I have an amendment at the desk to the motion to concur with amendment.
The clerk will report.
The Senator from South Dakota, Mr. Thune, proposes an amendment numbered 3962 to amendment numbered 3961.
Mr. President, I ask that the reading be dispensed with, and I move to refer the House message on S. 1071 to the Committee on Armed Services with instructions to report back forthwith with amendment number 3963.
Without objection. The clerk will report.
The Senator from South Dakota, Mr. Thune, moves to refer the House message to accompany S. 1071 to the Committee on Armed Services with instructions, amendment numbered 3963.
President, I ask for the yeas and nays on my motion.
Is there a sufficient second? There appears to be. The yeas and nays are ordered.
Mr. President, I have an amendment to the instructions.
The clerk will report.
The Senator from South Dakota, Mr. Thune, proposes an amendment number 3964 to the instructions of the motion to refer the House message to accompany S. 1071.
Mr. President, I ask the reading be dispensed with.
Without objection.
And I ask for the yeas and nays on my amendment.
Is there a sufficient second? This appears to be. The yeas and nays are ordered.
Mr. President, I have a second-degree amendment at the desk.
The clerk will report.
The Senator from South Dakota, Mr. Thune, proposes an amendment number 3965 to amendment number 3964.
And I ask the reading be dispensed with.
Without objection.
Mr. President, I move to proceed to executive session to consider calendar number 593.
The questions on the motion? All those in favor say aye.
Aye.
All those opposed, no. The ayes appear to have it. The ayes do have it. The motion is agreed to. The clerk will report the nomination.
Nomination, National Aeronautics and Space Administration, Jared Isaacman of Pennsylvania to be Administrator.
Mr. President, I send a cloture motion to the desk.
The clerk will report.
Cloture motion, we the undersigned senators, in accordance with the provisions of Rule 22 of the Standing Rules of the Senate, do hereby move to bring to a close debate on the nomination of Jared Isaacman of Pennsylvania to be Administrator of the National Aeronautics and Space Administration, signed by 17 senators as follows.
Mr. President, I ask consent the reading of the names be waived.
Without objection.
And I move to proceed to legislative session.
The questions on the motion? All those in favor say aye.
Aye.
Opposed, no. The ayes appear to have it. The ayes do have it. The motion is agreed to.
Mr. President, I move to proceed to executive session to consider calendar number 594.
The questions on the motion? All those in favor say aye.
Aye.
Opposed, no. The ayes appear to have it. The ayes do have it. The motion is agreed to. The clerk will report the nomination.
Cloture motion, we the undersigned senators. Nomination, Nuclear Regulatory Commission, Douglas Weaver of Maryland to be a member.
Mr. President, I send a cloture motion to the desk.
The clerk will report.
Cloture motion, we, the undersigned senators, in accordance with the provisions of Rule 22 of the Standing Rules of the Senate, do hereby move to bring to a close debate on the nomination of Douglas Weaver of Maryland to be a member of the Nuclear Regulatory Commission for the remainder of the term expiring June 30th, 2026, signed by 17 senators as follows.
Mr. President, I ask consent the reading of the names be waived,
Without objection.
and I move to proceed to legislative session.
The questions on the motion? All those in favor say aye.
Aye.
Opposed, no. The ayes appear to have it. The ayes do have it. The motion is agreed to.
Mr. President, I move to proceed to executive session to consider the in-block nominations listed in SRS 532.
Questions on the motion? All those in favor say aye.
Aye.
Opposed, no. The ayes appear to have it. The ayes do have it. The motion is agreed to. Pursuant to the provisions of SRES 532, the nominations listed therein are pending en bloc.
Mr. President, I send a cloture motion to the desk.
The clerk will report.
Cloture motion, we, the undersigned senators, in accordance with the provisions of Rule 22 of the Standing Rules of the Senate and the provisions of SRES 532, 119th Congress, do hereby move to bring to a close debate on executive calendar numbers 166, 267, 354, 429, 430.
Mr. President, I ask consent the reading of the names be waived.
Without objection.
Signed by 17 senators as follows.
And I ask unanimous consent that the reading of the names be waived.
Without objection.
Mr. President, I yield the floor.
I recognize the senator from Kansas.
Mr. President, the deadly collision that occurred here in our nation's capital between American Airlines Flight 5342 from Wichita, Kansas, and a U.S. Army Black Hawk helicopter on January 29, 2025, forever changed how we look and think about air travel. There were numerous circumstances that led to this horrific incident, and the NTSB, the National Transportation Safety Board's critical investigation into this collision is continuing even today. While the NTSB's final recommendations have not yet been released, the chair of the NTSB, Jennifer Hamady, took an unusual step in publicly stating that the current version of NDAA, the National Defense Authorization Act, does not adequately address the safety concerns surrounding the mixed airspace around DCA. She even went on to say that the legislation NDAA, she says, quote, reverses safety changes made after the mid-air collision, after the NTSB issued urgent safety recommendations, and after Secretary of Transportation Sean Duffy rightfully implemented NTSB's urgent safety recommendations. Based on the data and recommendations so far we received from NTSB, we know that, one, there should have been limitations to rotary travel in high-traffic areas of commercial air travel. Two, all aircraft in this space should be using position broadcast technology, nearly with no exceptions. And three, the users of this congested airspace should be communicating problems to each other, like the 15,000 near misses that occurred around DCA in a 3-year period between commercial planes and rotary aircraft. 15,000 near misses in 3-year period of time. The current NDAA text includes a provision which misses the mark on 2 of these must-have provisions. Therefore, I will insist and be working with my colleagues to amend the FY 2026 National Defense Authorization Act, or to otherwise pass legislation, perhaps in the appropriations process, of which I'm a member of that committee, to make sure that NDAA language is at least, as a minimum, abiding by the safety standards that were set in place after the crash of January the 29th. Our aviation system is fragile. I chair the subcommittee in Commerce on aviation and space. We have seen this in testimony time and time again. There is fragility in the safety of our air system. And over the last year, Congress has passed significant legislation to invest in the future safety of our airspace and introduced legislation to make our airspace safer, including the Rotary Act. Now is not the time. Now is not the time to step back from these efforts. I'm grateful for the hard work of NTSB Chair Hamady and her team, and I look forward to receiving their final recommendations when that time arises. And I also want to say thank you to the families of the victims of Flight 5342, who've continued to be vocal advocates for the safety of our airspace in honor of the loved ones they lost. Mr. President, it is important we not take a step back, but take a step forward. And I'll work in every way that I can with my colleagues to see that we accomplish that before the passage of the National Defense Authorization Act. Mr. President, I yield the floor.
I recognize the senator from Massachusetts.
Thank you, Mr. President. On Monday, President Donald Trump announced he will greenlight NVIDIA selling H200 chips to China. Now, these are advanced chips that the Chinese military has been after for years. Trump's own Department of Justice has called them, quote, the building blocks of AI superiority. And just hours before Trump's announcement, the Department of Justice announced a crackdown on a sophisticated trafficking network that allegedly smuggled $50 million worth of these chips to China. Why? Because they know that China is gaining access to these chips, and that poses a serious threat to our technological leadership and national security. So why did the president make this bad deal that sells out the American economy and sells out American national security? It's simple. In the Trump administration, money talks. And NVIDIA's CEO, Jensen Huang, knows it. Mr. Huang understands that in this administration, being able to cozy up to Donald Trump might be the most important corporate CEO skill of all. Mr. Huang paid a $1 million a plate dinner to be with the president. Mr. Huang's company has donated to the president's ballroom. And Commerce Secretary Howard Lutnick's former company, now run by his son, stands to make loads of money if NVIDIA's stock surges. Those are just the most obvious possible reasons to cut this deal. And who knows what else Mr. Huang might have done behind closed doors to persuade President Trump and Secretary Lutnick into making this dangerous concession. The American public deserves answers. Mr. Huang should be brought in front of Congress to testify under oath, and he should be joined by Secretary Lutnick and every other Trump administration official involved in this decision. Congress does not need to stand by helplessly. Both Republicans and Democrats understand the risks here, and we should pass bipartisan legislation that reins in this administration as soon as possible. The Guaranteeing Access and Innovation for National AI Act, called the GAIN Act, that Senator Banks and I introduced would prohibit NVIDIA from shipping advanced chips to China, while American universities, American startups, and American small businesses are waiting in line to buy the company's chips. Senator Ricketts and Senator Coons have introduced another bill that Senator Banks and I support. It's called the Safe Chips Act, and it would prohibit the president from greenlighting advanced AI chip sales to China. Republicans and Democrats have legislation ready to go, and we should get this done before it is too late. Senator Thune should schedule either or both bills for a vote immediately. Here's another thing that Democrats and Republicans in Congress need to keep an eye on. Will Donald Trump muzzle his own Justice Department because he does not want Americans to know that he is selling out our national security? Will Donald Trump order the Assistant Attorney General for National Security and the U.S. Attorney for the Southern District of Texas to dismiss the criminal cases that they just announced this week as part of the crackdown on chip smuggling? Will Donald Trump fire those Justice Department officials for exposing the national security risks of the deal that Donald Trump just cut? Will Donald Trump tell his Attorney General to drop all investigations into these national security concerns and turn a blind eye to how the Chinese military could use these chips to train weapons systems that could endanger American lives? I am deeply concerned that Donald Trump will target the work at the Department of Justice in a cynical attempt to hide the truth from the American people. And in case Donald Trump directs his Department of Justice to take down the public evidence or to cover it up, I'm going to read into the Senate record exactly how senior law enforcement officials warned about the dangers of allowing these chips to power the development of cutting-edge technology in China. Here is what the U.S. Attorney for the Southern District of Texas had to say, and I'm going to quote this. Operation Gatekeeper has exposed a sophisticated smuggling network that threatens our nation's security by funneling cutting-edge AI technology to those who would use it against American interests. These chips are the building blocks of AI superiority and are integral to modern military application. The country that controls these chips will control AI technology. The country that controls AI technology will control the future. The Southern District of Texas will aggressively prosecute anyone who attempts to compromise America's technological edge. End quote. That is what the U.S. Attorney, Donald Trump's own U.S. Attorney for the Southern District of Texas, had to say about the chips that NVIDIA has just been permitted by Donald Trump to put into the hands of the Chinese. And here's what the Assistant Attorney General for National Security at Trump's Department of Justice had to say. Again, Trump's own Assistant Attorney General for National Security, quote, "The United States has long emphasized the importance of innovation and is responsible for an incredible amount of cutting-edge technology, such as the advanced computer chips that make modern AI possible. This advantage isn't free, but rather the result of our engineers and scientists' hard work and sacrifice. The National Security Division, along with our partners, will vigorously enforce our export control laws and protect this edge." End quote. The president's most basic duty is to protect the economic and national security of the American people. And instead, President Trump is bowing to foreign dictators like Xi Jinping and selling out our national security to billionaire corporate interests that pay for special White House dinners and a gold-plated ballroom. Never before has a president and a tech CEO so brazenly conspired against the interests of the American people. Congress has a responsibility to stop it and stop it now. Thank you, Mr. President. I yield the floor.
I recognize the senator from Alabama.
I came to the floor earlier this year to warn of the imminent threat that Islam poses to our great country. Unfortunately, that threat turned into reality just a few weeks ago when a deranged jihadist shot 2 of our National Guardsmen just steps from the White House. Just before Thanksgiving, Specialist Sarah Backstrom and Staff Sergeant Andrew Wolf were on patrol near the White House when they were attacked by a Biden-imported Afghan Islamist. A 29-year-old jihadist radically, viciously attacked them, killing Specialist Backstrom and leaving Staff Sergeant Wolf in critical condition. He's still fighting for his life today. Our prayers go out to him and his family. So let's make it very clear. The Afghan terrorist attacked these 2 soldiers because that is what Islam teaches. The Quran says to kill all infidels. That means all people who don't believe in Islam. So let's not mince words about this. Islamists want every single American, and especially Christians, Americans, they want them dead. In 2021, Joe Biden orchestrated the botched Afghan withdrawal, which was one of the most embarrassing days in our country's history. 13 American soldiers lost their lives as a direct result of the Biden disastrous, misinformed leadership. Not to mention, he empowered the Taliban, who came crawling out of the hills to back control of Afghanistan. To make matters worse, Joe Biden then allowed more than 190,000, repeat that, 190,000 unvetted Afghans into this country, no questions asked. So, not to mention the more than $7 billion in equipment that was left behind for the Taliban, which is, by the way, is now showing up all over the world after it's been sold. These potential terrorists are now living amongst us, residing in our neighborhoods, going to our kids' schools, and mooching off our taxpayers' benefits. That withdrawal was an embarrassment and a stain on our country. The 29-year-old deranged terrorist who shot 2 National Guardsmen in D.C. was working with the CIA in Afghanistan and was part of an elite unit that was supposed to be helping fight our nation's enemies. Clearly, this person was deranged and should never have been allowed to work with our intelligence agencies or to come to the U.S., where he viciously attacked 2 American Guardsmen. While chanting Allahu Akbar, make no mistake, this is part of the deep state's globalist agenda that aims to destroy this country through mass Islamic migration. Where's the outrage from the people in this chamber? I hadn't heard it. If we don't do something to stop this Islamic takeover of our country, we will soon be called the United Caliphate of America. If the previous administration prioritized protecting American citizens instead of inviting terrorists to our country, Sarah Backstrom may still be alive today. Thanks to President Trump, a travel ban has been placed on Afghans along with people from 18 other third world countries, including Somalia. And I've got a message to the immigrants from these Islamist countries. If you hate this country, refuse to go by our laws, and chant death to America, it's time to go home. There's a lot of good people that come from Middle Eastern countries and go by our laws and assimilate with our culture. But if you come here otherwise, it's time to go home. The Trump administration is also prioritizing the deportation of Afghans who are already here illegally. You know, I'm 100% behind President Trump's effort to rid of all the Islamists who hate our country, as I just previously said. Take advantage of the system when you come here. Don't defraud our government. Don't come here to try to destroy us. Assimilate with the Americans in this country to make our country better. We should be welcoming immigrants who are willing to assimilate with our culture and to contribute to our society. That's what we want. Being in this country is a privilege, not a right. If you're an immigrant coming to this country, you need to leave your old way of life and the traditions behind and come here and work with us. Unfortunately, many of the Islamists who are here are not doing that. They're doing whatever they can to turn our country into the third world hellhole that they came from. We are different. We want a great country, not a third world country. These foreigners don't understand what this country stands for. This country owes you nothing but an opportunity to succeed. It doesn't owe you a handout. Islamist immigrants come to this country with a sense of entitlement. And that's what this country is not about. We'll give you a hand, but not everything. They believe the American people owe them something, and we don't owe anybody anything. They take advantage of our system. If this is your attitude, we don't want you here. We want you to help this country become better. The Somali population in Minnesota, as we've been watching on the news for the last few days, is an example of a group that thinks they're entitled to take anything they want from the American people and force Americans to bow to their will. Somali immigrants in Minnesota were recently caught stealing more than $1 billion and counting from American taxpayers. Stealing. They pretended to be using the money to feed children or help people with autism, but really they were stealing. They were stealing the money and sending it to terrorists in Somalia, all proven. This is pure evil, and it's straight from the pit of hell. Terrorists are driving around in Toyota Land Cruisers in Somalia, bought and paid for by the American taxpayers. Fox News recently reported that members of Minnesota's Democratic Representative Ilhan Omar's inner circle, people working for her, were personally profiting from this fraud. Omar held at least one event at one of the restaurants named in the massive fraud scheme. And by the way, one Congresswoman, Omar staffers, has already been convicted for his role in the fraud. It runs very deep. All of this is taking place inside of Omar's congressional district, and she's doing everything she can to defend these Somalia criminals. These people were empowered by woke and clueless so-called Governor Tim Walz, whose government handed the funds to these Somalia criminals, turned a blind eye. For example, one of the scams run by the Somalia nonprofit disguised itself as a housing assistance program. Sounds great. The initial budget for this program was $2.6 million. However, the annual budget quickly increased to over $100 million due to fake billing and fraud. And whose money is that? The American taxpayers. There were red flags all over the place. Tim Walz had every opportunity to see this, investigate, and stop this fraud and corruption. Instead, he looked the other way. That makes him complicit. He should go to jail for this. Anybody else would. And now he's trying to deflect by calling those who are angry about the Somalian fraud racist. Sure they do. That's the word they always use. This has nothing to do with racism. Somali immigrants stole more than $1 billion and counting from the American taxpayers. Again, proven. That should make every single American's blood boil. Democrats invite terrorists from all over the world into this country. They let them steal our benefits, enjoy our schools, overrun our hospitals, vote in our elections, and then steal our tax dollars to send back to their home countries to fund terrorism. By the way, I've seen all of these woke Democrats like Omar calling Somalia a wonderful place. If it's such a wonderful place, why doesn't she move back? If Somalia is all that, why is the terrorist group Al-Shabaab murdering Somalian civilians by the masses. And why is the capital of Somalia considered to be one of the most dangerous capitals in the world? Due to frequent terrorist bombings, targeting killings, and ambushes. That sounds like a place no one would ever want to visit or live. Predictably, Somalians often flee their country, and woke Democrats welcome these often unvetted individuals with open arms to the United States through illegal programs. But they make no attempt to adapt to the way in our American lives. Instead, they try to turn whatever American city they are hiding out in into Somalia 2.0. Thankfully, the Trump administration is working around the clock to reverse the evil open borders agenda that was allowed to thrive under Joe Biden's administration. Look, despite what the woke media will tell you, President Trump is not anti-immigration. President Trump is incentivizing and welcoming immigrants into the country who are going to come here to contribute and assimilate and love our country like we do. That's what we're all about. And if that is not you, if they don't want to do that, again, we don't want you here. The Trump administration has worked tirelessly this year to arrest and deport millions of illegals brought into the country by the Biden administration. Patriotic Americans are thankful for the work with DHS and ICE of what they're doing to clean up our streets. If we don't take this threat seriously, more terrorist attacks will take place, more stories of third world Islamists defrauding our country and using tax dollars to fund terrorism against the United States will become commonplace. DNI, Tulsi Gabbard, released a report not long ago about the imminent threat of terrorism that is facing our country. It's here. The recent terrorist attack in D.C. may just be the beginning of Islamic plans to destroy this country. The 29-year-old psychopath who did this should be hung in the streets. We need to send a message to every terrorist hiding out in this country just waiting to attack. We're not going to put up with this nonsense. You will be punished to the fullest extent of the law if you commit violence against American citizens. It's time to wake up, and it's time for all Americans to speak up. This is not a Democrat or Republican issue. This is an American issue. That's why I raised hell when I heard the Islam Academy of Alabama was looking to build a bigger campus in Hoover, Alabama just last week. You know, I looked at their website. They openly admit that they teach the Quran. The Quran teaches that it is righteous to kill anyone who is not a Muslim. Think about that. The media has called me a racist for calling this out. Radical Islam isn't a race. It is a political ideology, and it is a cult. So no, I'm not a racist, and people back in Alabama agree with me. I was proud to see hundreds of Alabamians show up to protest at the zoning meeting where the building proposal was being considered. I was asked about it, and I said the only place this Islamic Academy should be moving is out of Alabama and out of our country. We don't want that taught. Come here and assimilate with our laws. Go by our laws, nobody else's. As a result, this Islamic school withdrew their proposal. This is an example of what's going to take to defeat this poisonous ideology. This is an example of what we do not want to deal with. It's going to take all of us, red-blooded Americans, coming together and saying enough is enough. Europe has lost the war of immigration. It is no longer recognizable in a lot of the countries in Europe. Mass immigration by Islamists has ruined their way of life. They turned a blind eye, like we are at the moment, and are going to have to fight in the streets to get their countries back. It's coming. And that is exactly what's going to happen in this country in a few short years if we don't act now to save our country and our way of life. I achieved the greatest honor of my life this year, receiving the title of grandfather to Rosie Grace, my first granddaughter. And I want her to grow up in the same America that I had the opportunity and privilege to grow up in. If we don't stand up now, our grandchildren's future is going to be lost forever. We have to draw the line in the sand. You're either an American who loves this country or you're not. It is the job of the DOJ, the DHS, the FBI to arrest these people, these terrorists, these radical terrorists, and either put them in jail or send them home. Now's the time. We do not need to let the clock run out on us. Let's do not be Europe. Next year may be too late. Mr. President, I yield the floor.
The clerk will call the roll.
Ms. Alsterbrooks.
Senator from Texas.
Are we in a quorum call, Mr. President?
We are.
I'd ask consent that the quorum call be dispensed with.
Without objection.
Mr. President, in Texas, my constituents who are on the Affordable Care Act exchanges, otherwise known as Obamacare, are experiencing an 18% increase in their insurance premiums. Now, if you look at employer-provided coverage, which covers many, many more Americans, those increases in costs are going up roughly in the 5 to 6% range. So you might wonder why the huge disparity between Obamacare and the rest of health care. Of course, our health care system is pretty fragmented. We have people who have employer-provided coverage, seniors who have Medicare, low-income individuals who qualify for Medicaid, veterans who qualify for the VA system or TRICARE. But for the group of people who believed what President Obama said when he sold Obamacare about 15 years ago now, they've been deceived. I still remember like it was yesterday, the president said, if you like your policy, you can keep your policy. That was a lie. If you like your doctor, you can keep your doctor. Well, that was not true either. And then he said the average premiums would go down about $2,500 for people on these Affordable Care Act exchanges. Well, that wasn't true either. Years ago, I was Attorney General of the state of Texas. We had a consumer protection division, and where we would sue people who would consciously defraud consumers. And if this isn't one of the biggest consumer frauds perpetrated in our lifetime, maybe in history, I don't know what is. No Republican voted for Obamacare. We didn't think that was the best solution to providing access to health care. Only Democrats voted for it. And now they've created this incredible mess, this unworkable, unsustainable, unaffordable health care system within the rest of our health care system. And they look to us, Republicans, the people who did not create this problem, as, okay, now how are you going to fix it? They don't have any better ideas. As a matter of fact, what they want is more of the same. They want zero reforms. They want more waste, fraud, and abuse. They want more money to go to insurance companies. They want 100% of the tax dollars that pay for the Affordable Care Act or Obamacare exchanges. They want it to continue going to insurance companies. President Trump has said, let's get the money to the consumer so they can choose what they want. I think that's a better idea. Plus, insurance companies skim about 20% off of those taxpayer-provided subsidies for their administrative costs and profit. And you know what? Insurance companies are among the most profitable companies in America, certainly since Obamacare started. And then finally, they want to break what has been roughly a, 50-year consensus on whether tax dollars should be used to pay for abortions. We know abortions and that issue divides much of America. But one area that we have agreed on, this consensus back named after Henry Hyde, a famous legislator, House member from Illinois, is something called the Hyde Amendment that says no tax dollars can go for abortions. And Democrats want to throw that out the window. Well, rather than just point the finger at our Democratic colleagues, we actually have come up with a better idea. And I'm grateful to our colleague, Senator Crapo, chairman of the Finance Committee, and Senator Cassidy, a medical doctor who's head of the Health, Education, Labor, and Pensions Committee, for coming up with an alternative proposal, which is predicted to bring premium prices down about 11%. Now that's real money that people can use to spend on other things. Again, 18% increase each year after year after year. This is a train wreck for people on these affordable care policies. And as I said, the proposal by Senator Crapo and Senator Cassidy aligns with what President Trump has said, is let's get the money to the people. Wouldn't you rather have the money to buy the kind of coverage that you want and need? We are not all the same. We have people of different ages, different health care needs. Some young and healthy people may figure they don't need as comprehensive a coverage as older folks do. But our Democratic colleagues believe that we're all cut out of the same cloth and we are all the same when it comes to access need for health care, and that's just not true. This legislation that's been proposed, not by the Democrats who want more of the same broken system, the alternative that Senator Crapo and Senator Cassidy have proposed, we voted on it, and our Democratic colleagues did not support it at all. We sure didn't vote for this mess, what we call Dems' dirty Obamacare bill. This is a disaster, and it was sold under false pretenses, and we need to do better for our constituents who need access to affordable health care. Well, our Democratic colleagues are calling for a clean extension of the enhanced Obamacare subsidies because they don't want any changes in what I've described here. And that's the heart of the problem. We know there's a whole host of problems with this Obamacare subsidies, and any extension that fails to address them is more apt to be described as what I'd call a dirty bill. It doesn't solve the problem. So what are the issues? Well, first of all, we know that these subsidies are rife with fraud. In other words, your tax dollar is being misappropriated to fraudsters. We've been saying that all along, and now we have a new report from the Government Accountability Office which demonstrates beyond a shadow of a doubt what we've always suspected to be true. They documented it. The report paints a picture that makes the notion of a so-called clean extension with no changes outright laughable. That's not a clean extension. The investigators at GAO created fake identities and Social Security numbers for 24 individuals who did not exist. And they did this in order to find out what would happen when they took advantage of these Obamacare subsidies. They took these imaginary 24 and tried to enroll them in Affordable Care Act plans through Obamacare exchanges in 2024 and 2025. Shockingly, they were able to successfully enroll almost all of these imaginary individuals in subsidized coverage because the insurance companies were more than happy to take those tax dollars and in exchange for providing this phantom coverage. For 2024, the auditors were able to secure health coverage for all 4 of the applicants submitted worth approximately $2,350 a month. In 2025, 19 of the 20 applicants were able to qualify for subsidized coverage worth more than $10,000 per month. And these people didn't exist. Of the 24 fake identities, only one of them was not allowed to be enrolled. All the incentives for the insurance companies are, let's issue the policy. We don't care if this is a real person or not. What we want is the premium dollar, and we want the taxpayer to pay for it. The notion that someone can enroll in a taxpayer-subsidized health insurance policy with a non-existent identity should be enough to stop us dead in our tracks and say, we need to change it. We need to fix this. But the fraud does not stop there. GAO also found more than 29,000 instances in 2023 and nearly 68,000 instances in 2024 of a single Social Security number being used to enroll in more than one plan in a given year. So you had people with the same Social Security number able to enroll in multiple plans in a given year, meaning these Social Security numbers were being traded and assigned to more than one person. Again, all the incentives are for the insurance companies to issue as many policies as they can because that's how they make more money. During its probe, GAO discovered that the federal marketplace does not prohibit multiple enrollments per Social Security number. So under the status quo, which Democrats want to continue, one person could enroll in multiple policies. Again, in some instances, they may not even know that they're enrolled in multiple policies. The excuse given for this practice is it protects the Social Security holder's number from fraud or identity theft. But I'm sure we can find a better safeguard against Social Security fraud than simply letting multiple people enroll in healthcare with the same Social Security number without raising any questions or any red flags. So imagine if you were a victim of identity theft. Wouldn't you want to be notified if someone else was using your identity, your Social Security number, in order to get health insurance? Democrats have been telling us from time and time again that illegal immigrants cannot access taxpayer-subsidized health care. But we know from the GAO report that there are no mechanisms to prevent an illegal alien from enrolling in coverage if they have access to somebody else's Social Security number. And as if this isn't enough, the list of offenses go on and on and on. In 2024, CMS reported approximately 275,000 reports from consumers that they were either enrolled or had made changes in their insurance without their consent. Now, this is a problem. If you're taking a medication, or even if you have a particular doctor you like, having your plan changed without your knowledge or consent could result in the loss of coverage altogether or force you to change doctors unnecessarily. But this underscores one of the most significant problems that my Republican colleagues and I have raised with these so-called Obamacare enhanced subsidies. They directly lie in the pockets of insurance companies without lowering costs for consumers and taxpayers, and they do so in a way that's rife with fraud. When insurance brokers are enrolling patients or making changes to their coverage without their consent, the insurance company receives those tax dollars for the enrollee. But since the patient doesn't or may not have knowledge that they've even been enrolled, or perhaps that they're already enrolled in some other policy elsewhere, the insurance company will have to pay out zero in claims. That's what insurance companies like. They like to collect the premium and they like to pay as few claims as possible. So it's a perfect arrangement for them. But it's not for the taxpayer. These Obamacare enhanced subsidies are rife with fraud and should not be extended without meaningful reforms. In addition to the problems raised by the GAO report, the subsidies don't contain HIDE protections. I mentioned that a moment ago. People who have conscientious objection to abortion policies shouldn't have to be forced using their tax dollars to subsidize it for people who want to fund abortions and transgender procedures. Again, this used to be the 50-year-long consensus known as the Hyde Amendment. Many hardworking taxpayers who elected us have religious or moral objections to these operations, myself included. And the government should not be forcing Americans to participate or subsidize practices that violate their deeply held beliefs by financing them with their tax dollars. The Democrats' plan does nothing to address rampant fraud, the use of tax dollars to line the pockets of insurance companies, and the lack of HIDE protections for these subsidies. The lack of these changes does not mean this extension proposed by Democrats is clean. Far from it. We understand, I understand, that Texans need access to affordable health care, but this is not it. We will look forward to working together to find a real workable solution to health care affordability. What I worry about is that our Democratic colleagues really don't want to solve this problem. They want to have a political issue they can ride all the way to the midterm elections. And that's not just a cynical view of mine. I think that's a very likely reality. We can do better. We need to do better. Our constituents expect us to do better by working together to come up with affordable solutions for them without taking advantage of the taxpayers and lining the pockets of wealthy insurance companies. Mr. President, I yield the floor, and I'd note the absence of a quorum.
Clerk will call the roll.
Ms. Alsobrooks.
Senator from Tennessee.
Ask consent to vitiate the quorum.
Without objection.
Mr. President, I rise today to speak about the unaffordability of health care, a crisis created and perpetuated by my Democrat colleagues across the aisle. 15 years ago, without a single Republican vote, congressional Democrats authored and signed into law the so-called Affordable Care Act, also known as Obamacare. Ever since, congressional Democrats, without Republican support, have continued to prop up this failed system with tax credits and bogus incentives to hide a broken foundation. Congressional Democrats even expanded these tax credits under the guise of the pandemic, again on a wholly partisan basis, not once, but twice, which included setting a deadline for their expiration this year. Now, they're expecting the American public to believe that Republicans are culpable for what the Democrats have done. They have clearly broken the system. When Obamacare passed in 2010, Democrats promised the American people that this legislation would make insurance affordable. Sadly, this promise has gone unfulfilled. I've heard from constituents across my home state of Tennessee who are grappling with the realities of this broken system. In 2014, the premium for a benchmark plan was $197. That's 2014. In 2026, that premium is expected to be $711. That's an increase of 260%. As if this wasn't enough evidence, take the story from a constituent in East Tennessee who's self-employed. He and his wife own and operate a consulting firm. For his family of three, their insurance premium for the exact same plan they had this year will increase from $1,400 a month to $2,200 a month. No new coverage, no additional family members, just higher cost from an inefficient and fraud-ridden system that's collapsing under its own weight. This is not affordable health insurance. If health insurance were truly affordable, then Tennesseans like the one I just mentioned would not be forced to rely on taxpayer subsidies just to afford their monthly premium, not to mention out-of-pocket costs like deductibles, co-pays, and co-insurance. Beyond affordability, the Democrats promised to, quote, fix the health care system without adding to the national deficit. Their reforms were supposed to lower the deficit by more than $100 billion. Instead, according to the Committee for a Responsible Federal Budget, Obamacare has cost taxpayers an additional $1.3 trillion. The deficit has continued to grow, with health care spending being a major driver of that deficit. Welcome to socialism, my friends. Obamacare was supposed to end abuses by health insurance companies and create what they called robust and competitive marketplace. Well, Obamacare has been nothing but a profit-making machine for insurance companies. Obamacare has funded tens of billions of dollars, especially in pandemic-area subsidies, directly to insurance companies, and we've seen insurance companies' profits balloon to historic levels. Now let's talk about the fraud that prevails in the Obamacare system. We will never have a competitive marketplace when that marketplace is riddled with fraud. As a test for the ease and the extent of the fraud that plagues Obamacare, the GAO created applications for fictitious individuals, all using invalid information, and submitted these fake applications to the federal Obamacare exchanges for enrollment. The results? Shocking. Of the 24 invalid applications that were submitted, 23 of them, that's more than 95% of the applications, were wrongly improved for subsidized health insurance. Get that. Over 95% of these fraudulent applications were approved to be subsidized in Obamacare. As of this September, 18 of the 20 fake enrollees for 2025 are still covered. Not only did the Obamacare exchange not verify these fraudulent identities, but insurers didn't either. Why? Well, perhaps it's because those 18 applicants paid more than $10,000 per month to the insurance companies for these non-existent patients. The money wasn't paid to the patients. The money was paid directly to the insurance companies to the tune of $10,000 each. No wonder the insurance companies are complaining. No costs, no services provided, It all falls to the bottom line profitability of the insurers when this happens. The solution to this floundering system, created by the Democrats without a single Republican vote, is certainly not what Democrats have proposed today. They want to continue wasting Americans' hard-earned dollars. Earlier today on the Senate floor, there was a stark difference of views. On one side, Senate Democrats proposed a 3-year extension along with the repeal of anti-fraud provisions that we passed during the Working Families Tax Cut. More fraud, more waste, more ill-obtained profits for insurers. This unserious partisan proposal would cost a whopping $83 billion and would not lower premiums for 93% of Americans by a single cent. I oppose that effort. Instead, Republicans are offering real solutions that will lower benchmark premiums by 11%, save $30 billion by appropriating cost-sharing reductions, and empower patients to make their own health care decisions. There are further Republican solutions being debated right now, solutions that add serious fraud protections and ensure that wealthy Americans are not receiving taxpayer subsidies. Solutions that ensure no federal funds are used for abortions, that ensure illegal immigrants aren't accessing these credits to free ride and overwhelm the American healthcare system. I hope my Democrat colleagues will stop playing their political games and begin to work with Republicans to actually lower the cost of healthcare for the American people. Thank you, Mr. President. I yield the floor and note the absence of a quorum.
Ms. Also Brooks.
Mr. President, request that proceedings under the quorum call be dispensed with.
Without objection.
Mr. President, I ask unanimous consent that the privileges of the floor be granted to my intern, Rachel Shaw, for the month of December 2025 in the 119th Congress.
Without objection.
Thank you, Mr. President. There's been a lot of discussion today following the votes on the floor this morning about health care and health care costs. It was just about a year ago exactly. It was the 12th of December last year. I spoke to a reporter from Alaska, and we were talking about the just staggering costs of health care costs and what we were seeing with the rise. And at that time, I pointed out to this reporter that Alaska had already seen 3 years of premium increases that exceeded 50% in total. This was putting a pressure on individual and household budgets in a way that people were telling me this is an unsustainable trend. And I said then that we're going to have to address the issue of the enhanced premium tax credits at the federal level. We're going to need to address the fact that these come to an end at the end of this calendar year. And I said then, we've got a year to kind of figure this out, to buy time to pursue what I feel are important, and that is the true reforms, some of the long-term reforms that will not just help us address the cost of health insurance, but more importantly, the overall cost of health care in this country. That's the driver there. That's the problem. So that was about a year ago, almost exactly a year ago. And yet, here we are. Little has changed. Key transparency legislation remains stalled. Too many Alaskans are facing premium increases that are now approaching 500%. Think about what that means. I've shared with some colleagues a text that I received from a friend of mine in Fairbanks, and she and her husband will be looking at the potential for premiums in the range of $36,000. Nobody that I know of that can afford premiums for $36,000. So we know we've got a job here in the Congress. We know that we have to address this issue of rising cost to health care. But what we're facing right now, literally on this 11th day of December, the immediate issue is this expiration of the enhanced premium tax credits and this cliff that is in front of thousands of Alaskans about 24,000 Alaskans. Millions of Americans are facing this. So this morning, we saw what we saw. The Senate voted on 2 dueling health care proposals to address this cliff. Both proposals were partisan in nature. Neither one was written in a committee setting or reported through what we refer to as the regular order process. And unfortunately, neither really included any attempt at compromise. Neither tried to gain the support from the other side or to address perhaps the very valid concerns that were raised by the other side. And so it's no surprise that we are where we are, which is 2 failed votes on the Senate floor. And those measures failed. But Mr. President, I would just suggest that we have failed. We have failed, this institution here in the Senate. We failed to work together. We failed to reach consensus. We failed to help all those who are facing these shockingly, completely unaffordable increases in their health care premiums as they're looking at the new year. We voted on a Democratic proposal as part of the agreement that allowed us to reopen the federal government after a record-setting but ultimately a pointless 43-day shutdown. And the headline of that measure was that it would extend the current subsidies for 3 years. Unfortunately, there is no recognition of the much-needed reforms. 2 speakers preceding me both pointed out there are flaws in the existing system. If we're going to be addressing a program and a continuation of it, I think it's our responsibility to make sure that we're making sure that these programs don't have waste, that they are not being abused. But we also voted on a Republican proposal which would have pre-funded health savings account. This is something that so many Americans are very familiar with, but it would allow for Americans to receive dollars more directly in their hands, to go in their pockets for their own care, while also funding cost-sharing reductions, projected to reduce premium costs down the line, and some other provisions. But it was good work by the chairman of the Health Committee, as well, working with the chairman of the Finance Committee, and I was encouraged by what we were beginning to see there, but there were flaws, quite honestly, with that approach as well. So where did I end up? I ended up voting in favor of the motion to proceed to both of these proposals. But I want to be clear here. It's not because I fully endorse the Democratic proposal and I fully endorse the Republican proposal. Neither of the proposals, in fairness, met the challenge as far as I'm concerned. The Democratic proposal would have extended the status quo under the Affordable Care Act, which, as we have heard, has failed to restrain costs, and it's done so for longer than necessary to build the stability that I think we need to develop better policy. And more importantly, it included no reforms whatsoever. And we have seen examples of how the system has been abused. And as stewards of federal taxpayer dollars, it's incumbent on us to address matters like that. And so making sure that there were legitimate reforms, making sure that we don't set up another cliff, just like we would have done under the Democratic proposal. You just set up another cliff in 2029. And that cliff would look even more staggering if we just continue to allow and subsidize unchecked premium growth. And then on the proposal, on the Republican proposal over here, again, I give credit to the authors of that measure because it did focus on some longer-term reforms that I do believe can help people over time. But what it didn't address was the immediate situation that folks are facing, this immediate cliff, the pain, the imminent pain that's going to come with this massive spike in premiums. In Alaska, again, maybe it's more extreme than in other states, but we are still one of the 50 states. And when you're talking about premium increases that are doubling or in many cases tripling, that is not sustainable. And so we had a proposal that had its flaws. There were also some provisions in the Republican bill that we know were not going to garner support from across the aisle. And I guess where I am today, as most members have left the chamber, have left the buildings, are going back to their states for the weekend, we're doing this, we're leaving with unfinished business, and this is something that we've known was coming for a long time. For a long time. It's not like this just crept up on us. We had a chance to address it in budget reconciliation, but we couldn't agree to do so. We were told, no, you know, we got a lot of time on that. We'll do it later. That would have been a win on health care. We would have avoided this anxiety that we're in right now. We had a chance to address it, to avoid or end the shutdown, but same story, we weren't able to do that. And so we let the clock run. We wait and we wait, and we settled for competing proposals, and now we are where we predicted, where I predicted we would be. We failed in both, and nobody wins from that. Nobody wins from this, either politically and certainly not in real life. Mr. President, as I was coming over here, I asked some of the folks that were with me, I said, what day is Festivus Day? Festivus, for those who are not familiar with it, it's kind of like the Day of Grievances, which apparently is February 23rd, just before Christmas. And I'm not here to do a preemption of Festivus and just air grievances, because I don't think that's what people want us to do here. I think they want us to try to figure out, okay, you've demonstrated what you can't do. Now can you demonstrate what you can do? And that's where I want to put us. I refuse to accept that where we are right now, which is 2 failed bills, is the best that we can do. I voted to proceed to both proposals, not because they would solve the problem, not because they're great policy, but because I think they kind of represented the least bad options available to us at this 11th hour. Because I think we should be talking about it. We should be debating them, amending them, having an opportunity to do so on the floor, and seeing if we can't make some progress there. Sometimes out in the open gets us somewhere, not too often these days. But I'll tell you, the alternative, which is doing nothing and letting people suffer here, I think is worse. So again, today we showed the country what we can't do, but I wanted to show that there are bipartisan votes in the Senate that are eager, that are anxious for a bipartisan compromise. And I don't think it's too late for that. It's December 11th here. The year's not over. Our session is not over. I agree. We don't have a lot of time. We know that. But I think we can still come up with something that, again, would give people in this country comfort knowing that my premiums are not going to double and triple in the calendar year 2026. So that's exactly what I'm hoping the Senate is going to do, and what I challenge every one of us to focus on before we adjourn this year. And it's not like we're starting from scratch here. The ingredients for what we're going to need have been out there. We just need to get them all together and figure out how we're going to bake this. I think we know a lot of the work has already been done. We know the general contours of what an agreement could look like. By my count, there's no fewer than 8 plans that are out there. There's probably more than that we can draw from. You've got the Democratic bill that we saw, which was a 3-year offering. We saw the Cassidy-Crapo effort. Senators Marino and Collins have a proposal. I have put forward a proposal. Senator Rick Scott has, Senator Hawley, Senator Marshall, Senator Husted. There's a lot that's out there. And so many have been speaking about this for so long now. I put legislation on the table, a 2-year extension of the premium tax credits to buy us time to avoid this situation. I've also proposed ways to address it in both budget reconciliation and in my frameworks when we were trying to figure out how we end the shutdown. So there's not a lot of new stuff out here. We know what the component pieces are. And it's not just in this body. Look at what's happening down the hall here. Two bipartisan proposals by members of the House, and they are circulating for signatures so that they might be able to discharge and be able to move this. To me, Mr. President, I think that is really significant. You've got members in the House that are coming together and they're going to stand out, put their name up front on a bipartisan effort. Maybe it's not everything that they want, but they're willing to put something out there because they believe that the American people demand and deserve a solution. And so I'm encouraged. I'm really encouraged by the momentum that we're seeing coming out of the other body as well. And so if you take time to look at the proposals that are out there, you can see where we need to go. You can see where there's overlap. You can see where there's areas that serve as the foundation for an agreement. I think there's so many that agree that we've got to have some extension of an enhanced premium tax credits. Maybe it's not 3 years. Maybe it's we know it's at least 1 year. Perhaps it's 2. Most agree on the need for reasonable reforms to ensure that these credits are going to go to those who need them most and to protect the taxpayers who foot the bill from the waste, fraud, and abuse, because we know that that is real. We have to address that. We've got some good measures, good ideas on what to do there. They're already written. We can plug them into a bipartisan measure. And there's consensus for reasonable limits on who can receive the credits, and understanding that reforms need to be made, again, to reduce the fraud in the system. And I think we can do some of that through some of the program integrity reforms and by addressing plans where the customer is not currently paying any premium whatsoever. So again, I acknowledge the great work that Senator Cassidy has put forward with proposing solutions that give families options here when it comes to their health care choices. So here we are on the 11th of December. We've taken the partisan votes, and now we need to move forward. We need to develop a bipartisan product based on what we do agree on. And I firmly believe that it's in our reach if we try. But to get there in this short period that we have in front of us, we got to remember that none of us get to design this on our own. None of us will get exactly everything we want. The time for that is over. We've proven that no specific plan of that nature has the kind of support that we need. So we got to do better. We got to do better. We can't just say, happy holidays, brace for next year. That's our message to you. We need to focus on the people who are going to be hurt if we do nothing, and we need to set aside the politics and the partisanship that are preventing us from helping them. I think there is still a consensus to be had here, and know that I stand at the ready to do everything that I can to help in that effort before we adjourn at the end of this year. And with that, Mr. President, I yield the floor.
Senator from Washington.
Rise today to make a point clear, and that is that Section 373 of this year's National Defense Authorization Act poses a serious risk to the aviation safety and should be removed. Last night I came to the floor to raise alarm about this provision. Today I want to explain even more clearly why it is so dangerous and why it should be removed from this bill. This section, Section 373, eliminates safeguards added after the January 29th DCA collision. It weakens essential military aircraft technology standards, it enshrines these lower standards into law, and it leaves the public less safe. The National Transportation Safety Board chair, the head of the agency investigating the crash, has called this provision, Section 373, quote, a major step backwards from where we are today and an unacceptable risk to the flying public, end quote. And she adds, quote, an unthinkable dismissal, end quote, of the 67 families who lost loved ones. The families of Flight 5342 have said Section 373 does nothing meaningful to mitigate the risks that prove fatal for their loved ones. Senator Cruz, Moran, myself, and Senator Duckworth have pointed out in a joint statement that this provision needs to be stripped from the bill. We have worked on a bipartisan solution after much of the discussion and investigation by our committee, the Committee of Jurisdiction, the Commerce Committee, and said that in this Rotor Act, we should pass these provisions that would help still make aviation safer. Mr. President, the families of 67 victims are facing their first holiday without their loved ones. They have spent the past year advocating for meaningful reforms that, as I mentioned, we passed out of the Commerce Committee. They deserve to see real safety reforms, not a reversal of progress made since the tragedy. Let me explain to my colleagues how we got here. Current FAA regulations require aircrafts operating in busy airspace, including military helicopters, to be equipped with what is called ADS-B out technology. That stands for Automatic Dependent Surveillance Broadcast, meaning that the vehicle should be broadcasting out its location. It is a critical safety technology. When transmitting, it is broadcasting an aircraft's precise location, making it easy for air traffic controllers and nearby pilots to locate it. Even though that was the law, and it was clear it should be the law for really important safety reasons, in 2019, the first Trump administration issued a rule allowing for a limited waiver for sensitive government missions to operate without this broadcast technology. The rule specifically stated that this exemption should not be used routinely. It was meant for genuine national security situations, not everyday operations, meaning that there was an extreme case and they needed to use it for an extreme purpose. But the Army didn't do it for an extreme purpose. That's not how they treated the waiver. They abused the waiver. They operated 100% of their helicopter flights in the National Capital Region airspace without ADS broadcast technology transmitting out. Not some flights, not most flights, every single flight. I believe the waiver never should have been granted, that in a crowded airspace, it was a ridiculous idea to think that military helicopters and commercial airlines could be within just a few hundred feet of each other. That makes no sense to me. Then on January 29th, an Army Black Hawk helicopter on a training mission collided with American Airlines Flight 5342, obviously without its broadcast technology transmitting, and 67 people were killed, 60 passengers, 4 crew members, and 3 soldiers on the helicopter. It was one of the deadliest aviation accidents in the United States in decades. What we learned that the helicopters, we learned later, I should say, that the helicopters didn't have its broadcast equipment broadcasting out. It wasn't even fully functioning during the flight. And we learned that this wasn't some isolated incident, that the military had been flying in the busiest airspace in the country, right next to commercial airport in these flight paths for years without this requirement. Or even in their exemption being asked for, rarely used. Instead, they were routinely using the exemption. Why did the FAA even give them this exemption, to be within a few hundred feet of commercial aircraft? Why did they believe that the military was going to only use it in extreme conditions? The NTSB investigation revealed that there had been over 15,000 close proximity incidents between commercial aircraft and helicopter near the DCA airport between October 2021 and December 2024. The warning signs were there. The data was there, and yet nothing was done. After the crash, the FAA and the Department of Defense finally did take action, I'm sure under the scrutiny of the public outcry in the disaster. They closed helicopter Route 4 between Haynes Point and Wilson Bridge, the route where the collision occurred. They restricted non-essential helicopter traffic near DCA, and they required that when essential helicopter flights do operate in restricted areas, commercial arrivals and departures must stop. That was the recommendation after the crash. And critically, the FAA and DoD entered into an agreement requiring military aircraft operating in the DC airspace to broadcast via the ADS-B out broadcast system. This was a direct response to the crash and the urgency of the recommendations by the NTSB. But those recommendations, those are being rolled back in this National Defense Authorization Act in Section 373. Instead of strengthening the standards in this underlying bill, which is what our committee, and I'm pretty sure the House committee, in agreement, wanting to make even more improvements, we wanted to ensure that the military, the Army, was in compliance to improve the air traffic safety, but instead we have a bill that weakens it. What does Section 373 do to weaken it? Because I'm not sure all my colleagues understand this. I think some people are complacent about aviation safety. There's no room for complacency. You have to understand what the language does, and you have to understand that giving them an exemption to begin with was a mistake, and certainly trying to continue to get that exemption into law is also a mistake. Before the crash, the ADS-B out was already required by federal regulations for aircrafts operating in a busy airspace such as the National Capital Region. The 2019 exemption for, quote, sensitive government missions was supposed to be limited, but the military, as I said earlier, abused it by flying 100% of their helicopter flights without this transmission. After the crash, the FAA entered into an agreement, and that is why we are so frustrated, because now instead of strengthening the standards and closing the loophole, Section 373 does the opposite. It codifies the ability to fly without ADBS broadcast technology into federal law. What was a regulatory exemption that could have been fixed by the FAA instead now is becoming a congressionally sanctioned loophole on aviation that will make our airspace less safe. It is wrong-headed, and we should get it out of this bill. Under Section 373, military helicopter flights can operate in the DC Special Flight Rules area only with what I think some of my colleagues are thinking, this is really great, we'll just make it the TCAS system. That is a standard that exists, and that is a traffic alert and collision avoidance system. So they think, oh, that's the system we're implementing into law. One big fat problem. The TCAS doesn't work under the conditions that led to this crash. TCAS, the traffic alert and collision avoidance system, is inhibited by design below 900 feet. So during the descent, to avoid, basically you're in a cabin with the pilot supposed to be focused on landing, you do not have alarm bells and all the whistles and everything that distract the pilot at this critical function. So it doesn't really operate at below 900 feet. The DCA collision happened at 278 feet while Flight 5342 was descending. So this alert system did activate finally 20 seconds before impact, and the crash still happened because it was too late. As chair of the NTSB, Chair Hamidi wrote in her letter, quote, a requirement limited to TCAS compatible warning system would not ensure adequate safety for aircraft in the DC airspace, end quote. When are we going to listen to the investigators we pay to investigate why we had crashes and why people died? When are we going to listen to them and their recommendations? She continued, quote, Section 373 would roll back the broadcast requirements to the very conditions that existed in DC airspace at the time of the accident by allowing military aircraft to operate without ADS-B. Section 373 you think, well, how could it get worse than that? Now you're recreating the exact conditions of the accident, but it also includes a broad waiver authority. Any general or flag officer can waive even the most minimal TCAS requirements. These requirements that some of my colleagues put out a statement last night going, oh, we're good with this because it has TCAS in it. And now we have the NTSB saying that makes no sense because it doesn't even function in the type of accident we're talking about. And now, even within the provision, it says, oh, if you don't like that TCAS anyway, you can waive it because you've made a determination. Why is that so important? Because the military went to the FAA and said, we want an exemption for very, very limited use, and then used it 100% of the time. So do we think they're really telling us an accurate statement when they say, oh, we might want to get rid of TCAS too? Well, I believe they will not use TCAS, and it doesn't function in the accident requirement anyway. The NTSB investigation has shown that the Army and other military departments do not understand the complexities of DC airspace or how to conduct a thorough safety risk assessment. And while Section 373 requires the Secretary of Transportation to sign off on any waivers, Chairman Hamidi wrote that this provides little real protection, that the language gives the military departments broader latitude with no meaningful input from the FAA. Okay, so it just means the military can do whatever they want in the commercial airspace. The aviation industry and the affected communities are the ones that are going to continue to pay the price here. So let's be clear. The NTSB, our National Transportation Safety Board, its own investigation, found serious maintenance failures across the Army's helicopter fleet. The crash helicopter equipment was improperly installed and hadn't been working for more than 700 days. The Army never caught it. In fact, the helicopters in Battalion 8 of 16 could not even transmit when required to do so because of maintenance failures. There is a really big issue that we're going to hear a lot more about in January from the NTSB, and that's that the altimeters on the helicopters were also unreliable. My sense is the NTSB is doing really important engineering investigative work now to find out why those altimeters were so off. This is important to know because, again, if we're going to pass a bill saying go ahead military, operate in the commercial airspace, and you don't even have good altimeters, it presents even more risk. When the NTSB tested 3 other Black Hawk helicopters over the Potomac, their barometric altimeters showed the helicopters 80 to 130 feet lower than they actually were. So it just says that something is not working on these helicopter systems. Good investigative work. If you watch any of these shows, mid-air collisions, any of these things that document what the NTSB does, you will find that good engineering will come up with what is the problem with these helicopters on the altimeters, and they'll tell us something important that we needed to know. But we should not be flying helicopters around close to commercial aviation space within a few hundred feet when we know they aren't even accurate. In a crash that happened at 278 feet, this kind of error is the difference between life and death. This is the same Army that Section 373 would trust to conduct in its own risk assessment and decide when it's safe to broadcast their location. Again, why are we allowing military helicopter to fly within a few hundred feet of commercial planes? The Lilly family, who lost their son, First Officer Sam Lilly, in the crash, called out these waivers directly, stating, quote, "The national security waivers allowed by this draft are deeply concerning. This bill addresses that with a window dressing fix that will allow it to continue setting aside requirements with nothing more than a cursory risk assessment," end quote. After Section 373 only applies to a training flight. It does nothing to address VIP transport, operational missions, or other military flights that happen around DC every day. Even if this provision were good policy, which it's not, it would still leave the majority of military operations near commercial aircraft completely unaddressed. So, What we have here is a provision that rolls back the post-crash requirements that was agreed to by the FAA. It codifies a federal loophole that the military has already used, and basically in an environment where a crash was caused. It substitutes a technology standard that didn't prevent the crash to begin with and is not the recommendation of the agency charged with telling us what kind of improvement should be made. And it creates a broad waiver with no meaningful oversight. That is how we got into this situation. Let's say, for instance, there was a need for military aircraft up and down the Potomac close to the commercial flights. You would still set standards and you would have oversight. But we had thousands of incidents of alarm bells going off and nothing happened. Nothing happened to fix it. Nobody at the FAA, nobody at the military, nobody fixed it, and now, unfortunately, so many people have lost their loved ones. So, what's in this bill is not safety reform. It creates the appearance of reform, but it is not. That is why Senator Cruz and I, Senators Moran and Duckworth, have been working on comprehensive legislation, the Bipartisan Rotor Act, and would have loved that instead to be in this legislation. It's bipartisan. It basically is many of the recommendations that we've already heard from the National Transportation Safety Board that would make all of us, including those who fly on these flights, safer. The difference between our legislation and what they are talking about, well, as I mentioned, on January 29th, the Black Hawk wasn't transmitting, so it was eventually invisible. We want to make sure that we know where flights are. Our bill would set a national standard to ensure safety separation between military and commercial aircraft, not just in Washington, D.C., but everywhere. San Diego, Tampa, Norfolk, anywhere where the military and civilian aircraft share the skies. The Flight 5342 families agree. They have said, quote, "We continue to call for swift passage of the Bipartisan Rotor Act, which is a strong first step in addressing comprehensive nationwide reforms to ensure the tragedy like Flight 5342 never happens again," end quote. That is why we worked so hard. We're not even saying the Rotor Act is the final piece. As I said, the NTSB will make more announcements in January in their recommendations and their findings. But I know this, we should not be passing the National Defense Authorization Act with a huge loophole that is putting the flying public at risk. I hope our colleagues will realize this and work together to get this provision out of the legislation. I hope that you will think about the 67 families who lost their loved ones in this tragedy that was preventable. I hope that we will consider making sure that all our colleagues understand that transportation safety is not a one-day on-the-job issue. It is a constant in which we have to be vigilant about why it's so important to follow the rules and make sure the flying public is safe. The stakes are too high, Mr. President. Let's not go backward on aviation safety. Let's get this section out of the bill, and let's pass the Rotor Act. I thank the President, and I yield the floor.
The clerk will call the roll.
Ms. Alsterbrooks.
To recognize the Majority Leader.
Mr. President, I ask unanimous consent the quorum call be suspended.
Without objection.
Mr. President, I ask unanimous consent that the Senate be in a period of morning business with senators permitted to speak therein for up to 10 minutes each.
Without objection.
And I ask unanimous consent the Senate proceed to the immediate consideration of the following bills in block. Calendar number 177, calendar number 138, calendar number 177, H.R. 165, calendar number 138, S390, calendar number 174, S620, calendar number 186, S621, calendar number 187, S622, calendar number 175, S642, calendar number 76, S17, calendar number 148, S719, I'm sorry, calendar number 76, S719, calendar number 148, S723, calendar number 261, S546, calendar number 260, S240, calendar number 262, S640, calendar number 291, HR 504.
Is there an objection to proceeding to the measures on block? Without objection, the Senate will proceed.
Mr. President, I ask unanimous consent that the committee reported amendments where applicable be considered and agreed to. The Murkowski-Schatz amendment at the desk to calendar number 262, S640 be agreed to. That the bills as amended, if amended, be considered read a third time and passed, and that the motion to reconsider be considered made, laid upon the table, all in block.
Without objection.
Mr. President, I ask unanimous consent that the Senate proceed to the immediate consideration of calendar number 232, S1744.
The clerk will report.
Counter number 232, S1744, a bill to amend the Arms Export Control Act and so forth and for other purposes.
Is there an objection to proceeding to the measure? Without objection, the Senate will proceed.
Mr. President, I ask unanimous consent that the committee reported substitute amendment be agreed to, the bills amended be considered read a third time and passed, and the motion to reconsider be considered made and laid upon the table.
Without objection.
Mr. President, I ask unanimous consent that the Senate proceed to the immediate consideration of calendar number 254, S766.
The clerk will report.
Calendar number 254, S766, a bill to require an annual report of taxpayer-funded projects that are over budget and behind schedule.
Is there an objection to proceeding to the measure? Without objection, the Senate will proceed.
Mr. President, I ask unanimous consent that the bill can be considered read a third time and passed, that the motion to reconsider be considered made and laid upon the table.
Without objection.
Mr. President, I ask unanimous consent that the Finance Committee be discharged from further consideration of H.R. 1491 and the Senate proceed to its immediate consideration.
The clerk will report.
H.R. 1491, an act to amend the Internal Revenue Code of 1986 and so forth.
Is there an objection to proceeding to the measure? Without objection, the committee is just discharged and the Senate will proceed.
Mr. President, I ask unanimous consent that the bill be considered read a third time and passed, that the motion to reconsider be considered made and laid upon the table.
Without objection.
Mr. President, I ask unanimous consent the Senate proceed to the immediate consideration of calendar numbers 277, S1591.
The clerk will report.
Calendar 277, S1591, a bill to amend Title 38 United States Code and so forth and for other purposes.
Is there an objection to proceeding to the measure? Without objection, the Senate will proceed.
Mr. President, I ask unanimous consent that the committee reported substitute amendment be agreed to, the bill as amended be considered read a third time and passed, and the motion to reconsider be considered made and laid upon the table.
Without objection.
Mr. President, I ask unanimous consent the Senate proceed to the immediate consideration of calendar number 273, S610.
The clerk will report.
Calendar number 273, S610, a bill to expand the Vet Success on-campus program of the Department of Veterans Affairs and for other purposes.
Is there an objection to proceeding to the measure? Without objection, the Senate will proceed.
Mr. President, I ask unanimous consent that the bill be considered read a third time and passed, and the motion to reconsider be considered made and laid upon the table.
Without objection.
Mr. President, I ask unanimous consent that the Senate now proceed in block consideration of the following resolutions which are at the desk: S-Res 544 and S-Res 545.
Is there an objection to proceeding on block? Without objection, the Senate will proceed.
Mr. President, I ask unanimous consent that the resolutions be agreed to, the preambles be agreed to, and the motion to reconsider be considered made and laid upon the table all in block.
Without objection.
Mr. President, I ask unanimous consent that the filing deadline with respect to first-degree amendments to S-1071 be at 4 p.m. on Monday, December the 15th.
Without objection, so ordered.
Mr. President, I ask unanimous consent that when the Senate completes its business today, it stand adjourned until 3 p.m. on Monday, December the 15th, and following the prayer and pledge, the journal proceedings be approved today, the morning hour be deemed expired, the time for the 2 leaders be reserved for their use later in the day, and the Senate be in a period of morning business with senators permitted to speak therein for up to 10 minutes each. Finally, notwithstanding Rule 22, the cloture motion with respect to the motion to concur in the House amendments to S-1071 ripen at 5:30.
Without objection, so ordered.
Mr. President, if there's no further business to come before the Senate, I ask that it stand adjourned under the previous order.
The Senate stands adjourned until 3 p.m. on Monday. Thank you.
Enjoy more of our videos on the Community Advocate Network channel, and don't forget to like, share, and subscribe. If you would like to advertise your service, special announcement, or event, you may contact us at the Community Advocate Network at gmail.com. For community resources or services, visit our website at www.canmichigan.com.